Good morning and welcome back after our summer break to this August 17th, 2021 meeting of the Santa Barbara County Board of Supervisors here in the Santa Maria hearing room. Madam Clerk, will you please call the roll?
Supervisor Hart. Here. Supervisor Lavanino.
Here.
Supervisor Nelson.
Here.
Supervisor Williams.
Here.
And Chair Hartman.
Here. Please stand and join me in the pledge. Ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. The next item of business is approval of the minutes from July 13th, 2021. Is there any discussion? May I get a motion and a second to approve the minutes?
Second.
And could we have a roll call vote?
Supervisor Hart.
Aye.
Supervisor Lavanino.
Aye.
Supervisor Nelson.
Aye.
Supervisor Williams.
Aye.
And Chair Hartman.
Aye.
Motion passes unanimously.
And Madam Clerk, do we have any announcements or changes to our agenda today?
Chair Hartman and members of the board, yes, thank you. I have a couple quick announcements today. And for members of the public and those joining us during our departmental item presentations, I would like to note for the record, as you can see, we do have Vice Chair Hartman as our acting chair today. So we will be calling her Chair Hartman, so there is no confusion. And we do have Supervisor Lavanino and Supervisor Nelson joining us virtually via Zoom. So again, I would just like to note for the record, we will be, when addressing the board, please address Chair Hartman and members of the board. Thank you.
And
Sorry,
go
go
ahead.
ahead, please. Additionally, we posted an addendum to the agenda on Friday, August 13th, 2021, to amend the closed session agenda to add conference with real property negotiators, Government Code Section 54956.8. Property is assessor's parcel number 005-080-006. This is Temple Street, Summerlin, California, 93067. Agency negotiator, General Services, Director Jeanette D. Pell. Negotiating parties, Maureen Fitzgerald, Assistant Superintendent of Carpinteria Unified School District, and Craig Price of Griffith and Thornburg LLP under negotiation, price and terms of payment. In addition, we amended administrative agenda item A9. This is from the clerk recorder assessor, and recommended action B has been amended to strike out under cooperative purchasing guidelines pursuant to county ordinance section 2-38. So recommendation B should read as follows. Waive further competition and authorize procurement of the imagery and software without conducting a competitive bid process based on the prior competitive process by Los Angeles County. And Chair Hartman, members of the board, we did receive a request to present administrative item A34, which was originally stated as an honorary resolution. A34 is sponsored by Supervisor Hart. This is to adopt a resolution proclaiming August 8th, 2021 through August 14th, 2021 as National Health Center Week in Santa Barbara County. I would also like to remind the public that the Board of Supervisors meetings are being interpreted and broadcast live in Spanish. We are broadcasting our meetings in Spanish both for Cox Cable subscribers in South County as well as Comcast Cable subscribers in North County. Members of the public can now view our meetings in Spanish by turning on the secondary audio programming, also known as SAP, in their language settings. I would like to note for the public today, we are experiencing some technical difficulties with our in simultaneous Spanish interpretation, and today's meeting will be broadcast later today and posted on our website as well. Lastly, I would like to remind the public who are participating in our meeting today of the board's updated methods of public participation. For the Board of Supervisors, methods of public participation and to provide public comment on general public comment or an item on the board's agenda, please see page 2 of our agenda. Members of the public can now attend meetings in person in both the Santa Maria Board Hearing Room chambers as well as the Santa Barbara board hearing room chambers. Please note, on August 6, 2021, a new county health officer order went into effect requiring indoor mask usage for everyone over 2 years of age, regardless of vaccination status. If you attend the board meeting in person, you will be required to wear a face covering or mask at all times, regardless of vaccination status. Individuals that would like to provide verbal public comment virtually may do so via Zoom by registering in advance via the link available on page 2. After registering, you will receive a confirmation email containing important information about joining the virtual meeting. Once the chair has announced the item you want to comment on, please join the meeting with the information provided in the registration confirmation email. You will be placed on mute until it is your turn to speak. The clerk will call you by name. When removed from mute, you will hear a notification that your line has been unmuted. If you are using a touch-tone phone, you may need to press *6 to unmute yourself. Again, if you are using a touch-tone phone via Zoom, you may need to press *6 to unmute yourself. Each person may address the board for up to 3 minutes, and this is at the discretion of the chair. If you have any questions about this process, please contact the clerk of the board's office at area code 805-568-2240. Again, please contact the clerk of the board's office with any questions at 805-568-2240. And that concludes my announcements.
Thank you, Ms. Alexander. Do we have a CEO's report today, Ms. Miyasato?
Chair Hartman, no report this morning.
Okay, then moving to our administrative agenda.
Chair. I had my hand raised. Supervisor Lavamino.
Yes?
I just wanted to let folks know that I'm actually going to be mobile all day. Sometimes the meeting I'm going to have to step out. I've had a little family medical issue. Everything's fine, but my schedule is going to be in and out today. And I've let the clerk know where I am and what I'm doing. But again, I know we've got some very important items to discuss today. And unfortunately, this was not something I could reschedule. And I'm going to do my best to be there for item 4. And I've expressed my concern about hearing that without me in the room, but we'll play it by ear, I assume.
Thank you, Supervisor Lavanino. Did you have any items you wanted to pull today from the administrative agenda?
I do not.
Okay, so are there any items that the public has pulled?
Chair Hartman and members of the board, yes, I have a request to speak on administrative items number 12, 20, and 2 requests to speak on A36.
Okay, would you read A12 into the record, Madam Clerk? I'll go back.
Chair Hartman and members of the board, administrative item number 12 is from Community Services. It is to consider recommendations regarding the approval of a subrecipient agreement and amendments for Emergency Solutions Grant, Coronavirus Round 2 ESG CB2 funding for COVID-19 homelessness response, excuse me. And we have 1 request to speak on this item, and that is Jeffrey Schwartz. And unfortunately, Chair Hartman and members of the board, it appears that Jeffrey Schwartz is not logged into Zoom, so perhaps we can return to this item.
And move on to A20.
Great, thank you. Chair Hartman and members of the board, administrative item number 20 is from Public Health. It is to consider recommendations regarding an Allen Hancock College Foundation agreement. And there is a 4/5 vote required on this item. And we have 1 request to speak via Zoom, and that is Amy Smith. Amy, please proceed with your comments. Thank you.
Thank you. I am very concerned that the messaging that the county is putting out, the health officer, is giving a false impression about the degree of emergency that we're facing. We've had one death in the last month, and that is tragic, but that is much lower than we've been facing. Everyone is reporting that the Delta variant appears to be more contagious, but not more dangerous, which is a good thing in a way if it's spreading immunity, natural immunity, and not harming people as badly. And we also have the lucky results of frontline doctors who've developed protocols that are more effective at preventing and treating all of these variants than the experimental gene therapy shot.
Ms. Smith, I believe we have you speaking to the wrong item. It sounds like you're talking about departmental item number 1 on the coronavirus presentation, but what we have you speaking to now is item A20. Would you like to come back for departmental item number 1?
No, I'm trying to motivate my concern that the way that vaccination center is being put up and what messaging is being given, and considering what the county health officer is putting out, I would argue that you are coercing people into an experimental treatment that is not the best way to treat and prevent the spread and the contraction of COVID, and has dangerous risks from a liability protected industry, and that the data even that the county is, the way it's being presented, as I wrote to you all, and I hope you had a chance to read my comments, and I apologize, they were rather long, but that the way the data is being collected and presented is creating a false impression of the degree of seriousness that we're facing. Of course, there's still sickness. Of course, we still want to protect people, but we're not giving the best information. And that means we are misinforming and not giving informed consent towards making that choice to take this brand new experimental gene therapy treatments that have no long-term studies to demonstrate whether they're going to increase the likelihood of infertility, the likelihood of cancers, autoimmune disease, neurological degeneration. We've had plenty of young people hospitalized with myocarditis. There's been more than 12,000 deaths reported. So I know this is also connected to the whole status of COVID and how the county's faring and facing it. But I'm very concerned about ways that we have been all this time coercing people into a one strategy, especially considering that people with natural immunity aren't first encouraged to check and see if they have immunity before considering a vaccine, since natural immunity is understood to protect better and is safer and has no risk, because if you've already acquired the immunity, then there's no additional risk to just doing nothing. So and what efforts are being made to encourage young people to improve their overall health with their vitamin D status, getting outside, getting regular exercise, making sure to have plenty of vitamin C in the diet, making sure
Thank you, Ms.
zinc
Smith.
status
That is your time, and we
Thank you.
appreciate
Thank you
your
very much.
comments. Thank you for participating. Are there any more public comments on this item A20, Madam Clerk?
Chair Hartman and members of the board, that was our only request to speak on this item.
Okay, and I believe Supervisor Nelson would like to speak to this.
Yes, thank you, Chair Hartman, and thank you for standing in for me today. Since this item has been pulled, I wanted to take the opportunity to highlight it and thank Allen Hancock College, Dr. Walters, and Noemi Ornalis. This item is along with one of the other items that we've had over the last couple of meetings, providing funding to Allen Hancock College. Allen Hancock College has been an important partner throughout the pandemic for the Santa Maria Valley and the county as a whole. And, I'm glad that Ms. Smith was able to pull it so I could celebrate them. And I'd like to move this item.
Thank you very much. Would you read A24 into the record, Madam Clerk? I'm Supervisor Williams wanted A24.
Just for a separate vote. I don't need to
But
come.
we need to read it into the record anyway, I believe.
Chair Hartman and members of the board, administrative item number 24 is from Public Works. It is to consider recommendations regarding an ordinance amending speed limits specified in County Code Sections 23-15.4, 23-15.5, 23-15.6, 15.7, and 23-15.8. This is in the first and third districts.
Thank you. And I assume there's no public who would like to speak on this. So, and Supervisor Williams, you just want a separate vote. You didn't.
Yeah, I mean, I just think sometimes it's a good idea to do a symbolic, if ineffectual vote. And I want to put a symbolic vote against this today because the way the state determines speed limits is totally bad policy in my view. And this is an example of a place where there's already a decent amount of speeding. And now in reaction to people breaking the speed limit,
Yep.
we are required by the state to raise the speed limit. And that seems to the public particularly dysfunctional. But
So we will have a vote. I believe that the legislature is looking at this and we'll get some legislative change soon to that policy. Madam Clerk, then would you call the roll on that item, A24?
Chair Hartman and members of the board, did we get a motion and a second on that item?
Supervisor Williams, you move that we, well, yeah, I need, sorry, Supervisor
I'll
Hart,
move that we have approved item 20.
and I will
Thank you.
second that.
Thank you. Supervisor Hart,
Aye.
Supervisor Lavanino.
Aye.
Supervisor Nelson,
Aye.
Supervisor Williams,
No.
Chair Hartman.
Aye.
Motion passes 4-1.
And could we go back to A12 and see if the commentary is ready?
Chair Hartman and members of the board, yes, it appears our request to speak is here, and it has been previously read into the record, but as a reminder, administrative item number 12 is from Community Services. It is to consider recommendations regarding the approval of a subrecipient agreement and amendments for Emergency Solutions Grant Coronavirus Round 2, ESG CV2 funding for COVID-19 homelessness response. And we have one request to speak on this item, and that is Jeffrey Schwartz. Jeffrey, you can begin your comments. Thank you.
Can you hear me?
Yes,
Yes,
we
we-
can.
Okay. You're basing your coronavirus assessment on a very one-sided view of things. Virtually hundreds and thousands of doctors and scientists are being censored on this issue. They're not being allowed to speak on the mainstream media, on the social media platforms. They're all deplatformed and comments removed. Your testing for this is highly flawed. Even Tony Fauci admits that when the cycle threshold of the PCR test is above 28 cycles, it's almost meaningless, the results. So this entire thing is based on a completely flawed and fraudulent test. So basically, this whole thing is founded on a fraud. You're trying to assault the entire Bill of Rights, freedom of speech, freedom of assembly, freedom to worship, closing churches, closing businesses. This is totalitarianism in the making. And you guys really are just pawns. All of these orders and policies are top down from the World Health Organization, CDC. You're just following orders. And I know you think you're doing the right thing, but you're pawns in a bigger game. This is a game of fraud. This is a game of deception. And this is a game of trying to eliminate the Bill of Rights. Nowhere in the history of the world have healthy people been told to stay at home and lock them in the home like they're prisoners. And going in and destroying small businesses. This is a very evil agenda. And you guys, I don't think, really know what you're doing. You're just following orders. So I think you need to look at the picture and see what's going on. Go and check out what's been censored off the YouTube, off of the entire internet. I would recommend going to some sites like Frontline Doctors, these U.S. licensed doctors have a completely different view of things. They're all being censored, and you guys don't know what you're doing. This is a Trojan horse designed to destroy the Bill of Rights. I know you don't think you're doing that, but that's what the people up above, where you get your orders from, that's what they're doing. Thank you.
Thank you, Jeffrey. You were commenting on item A12, which has to do with the grant for navigation services and freedom warming centers throughout the county. I believe you wanted to comment on D1, but we will consider your comment then to be early on D1. Yes,
I
Supervisor
just
Hart.
want to say that thankfully we have medical doctors here with us for item D1 who can answer questions that people have, legitimate questions people have about the science regarding COVID-19 and the new Delta variant and the implications of that science for public health and our strategies. And we're going to have a very good comprehensive presentation and discussion about that item rather than these individual comments from individual people on items that are tangential to that conversation. So I'm looking forward to that.
Thank you, Supervisor Hart. That brings us then to A34. Madam Clerk, would you read that into the record?
Chair Hartman and members of the board, administrative item number 34 is sponsored by Supervisor Hart. It is to adopt a resolution proclaiming August 8th, 2021 through August 14th, 2021 as National Health Center Week in Santa Barbara County. And receiving this resolution via Zoom today, we have Scott Black, American Indian Health and Services, Richard Mattins, Santa Ynez Tribal Health Clinic, Dr. Charles Fenzi, Santa Barbara Neighborhood Clinics, Ron Castle, Community Health Centers of the Central Coast, and Dana Gamble, Santa Barbara County Public Health Department. Thank you for joining us today. And I will go ahead and read the resolution into the record. Whereas Santa Barbara County is home to 5 community health centers designated as Federal Qualified Healthcare Centers, FQHC, including American Indian Health and Services, Community Health Centers of the Central Coast, Santa Barbara County Public Health Department, Santa Barbara Neighborhood Clinics, and the Santa Ynez Tribal Health Clinic, providing high-quality, affordable, comprehensive primary health care in our county's underserved communities. And whereas the FQHCs in Santa Barbara County are the healthcare home for over 107,450 residents. Every day, the centers provide a wide range of services beyond primary healthcare, including vision, dental, behavioral health, pharmacy, and other medical specialty services to meet the needs and challenges of county residents. 1 in every 4 county residents gets their care at an FQHC location. And whereas community health centers are on the front lines of emerging healthcare crisis, providing access to care for our nation's veterans, addressing the opioid epidemic, and responding to public health threats in the wake of natural disasters. And whereas the county's community health centers provide essential resources and support in testing and treatment in the face of the global coronavirus pandemic, and will continue to offer reliable, affordable, high-quality care against COVID-19 for Americans' most vulnerable and underserved communities. And whereas National Health Center Week offers the opportunity to celebrate the dedicated staff, board members, patients, and all those responsible for their continued success and growth since the first community healthcare centers opened their doors more than 40 years ago. Now, therefore, be it hereby ordered and resolved that this Board of Supervisors does hereby proclaim August 8th through 14th served as National Health Center Week in Santa Barbara County, passed and adopted today.
Thank you. Do we have any public speakers signed up for this item?
Chair Hartman and members of the board, we have no requests to speak, but perhaps one of our recipients would like to provide some comments this morning.
Let's first go ahead and have a motion and vote on the item, and then then it's official and we can hand off the resolution. May I have a motion
I'll move approval.
and a second?
Second.
And please call the roll.
Supervisor Hart,
Aye.
Supervisor Lavanino,
Aye.
Supervisor Nelson,
Aye.
Supervisor Williams,
Aye.
and Chair Hartman.
Aye.
Motion passes unanimously.
And Supervisor Hart would like to lead off.
Yeah, I just want to say thank you to all the folks that are here today to recognize the community health centers. They are an incredible resource in our community. Fortunately, we have them distributed throughout the county, serving populations that need better access to healthcare. And it is astounding to me that these clinics collectively combined serve nearly 1/4 of all the residents in Santa Barbara County with very high quality comprehensive healthcare services. So we're really fortunate to have them and the volunteers and the staff and the donors that help support those entities to do their work. And this is a great opportunity to recognize them and to thank them for their service to all of Santa Barbara County.
Thank you so much. This is Dana Gamble from the Public Health Department. I'd like to say thank you to Chair Hartman, Supervisor Hart, and the other members of the board. As the interim deputy director of the Primary Care and Family Health Division of the Public Health Department, I serve as the director of our 5 county healthcare centers and 3 shelter-based clinics. We appreciate this opportunity to be honored amongst the 5 designated FQHCs in Santa Barbara County. And these FQHCs, as you mentioned, include Public Health, American Indian Health and Services, Community Health Centers of the Central Coast, Santa Barbara Neighborhood Clinics, and the Santa Ynez Tribal Health Clinic. We serve the community together with one similar mission, and at the same time, we are each unique in the way we deliver healthcare to our patient population. The county is fortunate to have such diversity of options for the 1/4 of our county's population who access care at one or more of our locations. I personally don't recall a time where our 5 organizations have been celebrated together in this way. So not only is it an honor for me to be represented amongst this group, it's also of special significance. And I would really like to take an opportunity to introduce and acknowledge the directors of the other FQHCs based in Santa Barbara County, starting with Scott Black at American Indian Health and Services. He's here with us this morning. Ron Castle, who is the Director of Community Health Centers of the Central Coast. He could not make it this morning. Dr. Charles Fenzi from Santa Barbara Neighborhood Clinics is here today. Thank you, Dr. Fenzi. And Richard Mattins from the Santa Ynez Tribal Health Clinic, the newest member of our director group. So welcome, Richard. Thank you all for your service as an FQHC. Thanks again, Chair Hartman and members of the board.
And thank you, Mr. Gamble, and to all those you work with. It really is a tremendous asset for our community. Supervisor Williams?
Well, I think that the employees and leadership of these clinics are doing an incredible job in a tough time, and they do deserve our thanks, both for the COVID response, but also they're dealing with the ancillary problems. They see an enormous amount of clients in small spaces, and so they also exhibit heroism doing it. But I also think that coping with kids that are having to deal with more screen time, less physical exercise, more health problems, more mental health issues. And I particularly will, I hope you guys won't mind, do my favorite hero in our clinic system, which is my wife, Dr. Johnny Williams, a provider a psychologist at American Indian Health and Service.
Thank you. Turning to item number 36, Madam Clerk, would you read that into the record?
Chair Hartman and members of the board. Administrative item number 36 is sponsored by Supervisor Hartman and Supervisor Lavanino. It is to adopt a resolution of commendation recognizing community volunteers and organizations who mobilized to address food insecurity in Santa Barbara County during the COVID-19 public health emergency. And joining us today as well on Zoom and in person. If you are here in person and would like to come to the podium, please do so now. We have Magdalena Sunshine Serrano from the Community Health Centers. And additionally, we have Maribel Landaros, Audie and Jesse McDonald, Isla Linares, Ron E. Castle, Maria Arteaga, Jacqueline Valencia, Jamie Diggs, Monica Buenrostro, Humberto Santa Maria, and Mark Aguirre. And I will go ahead and read the resolution into the record. Whereas the COVID-19 pandemic is a global public health emergency that has upended the lives of so many people, sparing no country, government, or population. And whereas the COVID-19 pandemic exacerbated existing vulnerabilities and had an outsized effect on the health, safety, and livelihoods of marginalized communities and communities of color. And whereas shelter-in-place orders, quarantines, and other movement restrictions related to COVID-19 disrupted people's safe access to basic services, and especially people's access to food. And whereas, according to the USDA, rural and farming dependent counties in the US, much like northern Santa Barbara County, had the extremely high cumulative COVID-19 case rates. And whereas migrant and seasonal farm workers, residents of high density housing, and disabled community members were especially vulnerable to contracting COVID-19 and or lose their employment, and as a result become food insecure. And whereas local nonprofits and community groups in Santa Barbara County, like Community Health Centers of the Central Coast, Food Bank of Santa Barbara County, HOPE, Promotoris Network Health Linkages, recognize the need for additional food distribution programs during the COVID-19 crisis, and many dedicated community volunteers mobilized to meet increased food needs. And whereas these organizations and volunteers not only assisted in providing food access, but also provided personal protective equipment like masks and hand sanitizer to over 17,262 individuals and 6,068 households, created culturally relevant mental wellness information for families, a youth publication to reduce stress caused by the pandemic, health, nutrition, and COVID-19 prevention education. And whereas the County of Santa Barbara recognizes the importance and value of partner agencies, nonprofit organizations, and volunteers who help so many community members in need during the COVID-19 pandemic. Now, therefore, be it hereby ordered and resolved that this Board of Supervisors proclaims the following addendum of organizations and individuals be recognized for their tireless and heroic efforts to serve the most vulnerable community members during the COVID-19 health emergency, so no community member went hungry. Passed and adopted today, and I will go ahead and read the addendum. Addendum of community members and organizations that mobilized to serve the most vulnerable during the COVID-19 public health emergency. Community Health Centers of the Central Coast, Food Bank of Santa Barbara County, Santa Barbara County Promotoris Network Health Linkages, Naomi Velasquez, Community Health Centers of the Central Coast, Humberto Santa Maria, Sergeant United States Army, Mark Aguirre, Senior Airman, United States Air Force, Melquisedec Ramirez, Mara Cano, Reina Mendoza, Jan Baumgardner, Seven Anda, Marie Ann Cooper, Bill Cooper, Geraldine Valadivizo, Ramon Valadivizo, Ana Mieja, Jocelyn Vicento Sixto, Sierra Irvin, Jed McClure, Monica Buenrostro, Jamie Diggs, Jacqueline Valencia, Kelly Padilla, Greg Hitch, Rafaela Bareza, Ana G. Santos, Ana Ruda Cortez, Fernando Solano, Conrado Perez, Colombo Solano, Martha Jimenez, Guadalupe Perez, Guadalupe Velasquez, Araceli Hernandez, Jasmine Velasquez, Magdalena Jackson, Mario Jackson, Olivia Gonzalez, Omar Hernandez, Brian Bendia, Angel Martinez, Cynthia Gonzalez, Leticia Garcia, Maria Rios, Beatriz Angeles, Hilda Rodriguez, Patricia Jacobo, Genesis Gutierrez, Manuel Ramirez, Maribel Landaros, Benny Valadaviso, Marcelo Santiago Cruz, Guillermo Gutierrez, Nancy Cadena, Lisa Casillas Semenza, Durali Jimenez, Andy McDonald from Hope House of Pride and Equality, Juliana Neal, also Hope House of Pride and Equality, Maria Ortega, Enrique Batista, and Judah Anda.
Thank you, Madam Clerk. That was quite a list. One of the most impressive things about the COVID era is the way that organizations and individuals have stepped up to help their neighbors, neighbors who've never needed this kind of help before. And it's really been extraordinary. And you in Santa Maria, in North County, that long list of names, people who are their time, they're cooking, they're helping, and it's heavy, hard work in many cases, and stuck with it for month after month. And so we're very, very grateful for your efforts. Supervisor Lavanino, are you here? Did you want to add something?
Actually, I thought you said it very well. Especially North County, what we might be lacking and other things we make up for with community spirit and pride. And so I really want to thank all those involved in this, looking out for your brother, your neighbor. That's what it's all about in a time of crisis. And again, stepped up in a major way. Thank you very much.
And would you like to speak?
Yes.
Thank you.
So members of the board, and especially Supervisor Hartman, Supervisor Lavignino, Supervisor Hart, Supervisor Williams, on behalf of Community Health Centers of Central Coast and our partners in Santa Barbara Food Bank, as well as the Health Linkages Promotores Network, and just the cross sector of community partners that have leaned in and showed up tirelessly for the last 17 months. I just would like to express our immense gratitude of this resolution of commendation, as well as the resolution proclaiming National Health Center Week in Santa Barbara County, as we rally our troops and ask people to show up again and again and place their own families and their own well-being at risk. These are the moments and the proclamations that make a tremendous difference in our morale and feed us in ways that otherwise are just simply not always accessible. And as someone who has the privilege and just the honor of serving on the front lines as a healthcare professional leading through this pandemic, I just really want to thank you, because the one pearl of the pandemic is that we realize that we all need to collectively work together if we are to get on the other side, and that the names read in the resolution represent a cross sector that has historically never come together, and what can happen when ego and politics are put aside and we just all work together in a culture of one. So thank you very much.
In a culture of one. Thank you. That's a wonderful concept. I believe, would anybody else like to speak from your group?
We're fine.
We do. Okay. We do have two people who'd like to speak publicly, and you're welcome to stay up here if you'd like and hear it. All right. Wherever you're most comfortable.
Thank you. Thank you.
Chair Hartman and members of the board, yes, we had two requests to speak on this item. We are going to begin with Enrique Batista, to be followed by Jeffrey Schwartz. And it does appear that Jeffrey is no longer available via Zoom. So Jeffrey, if you are still monitoring the meeting and would like to provide your comments, please log in now. Enrique, you can begin your comments.
Hello. I just want to say thank you to all the partners that was involved in doing the outreach in the community, especially CHC. They've been a huge partner to us in the community, especially touching those communities that are underserved, right? And those communities that are farm workers and just don't have the access and resources like a lot of us do. And yeah, I just want to say thank you to everyone that participated and kind of help out with this whole pandemic that we're facing.
Thank you for your comments.
And Chair Hartman, members of the board, that is our only request to speak on this item.
Okay, well, I just wanted to mention that, in each community, in each of our supervisorial districts, there are so many people who have stepped up to help their neighbors and I intend to bring forward some additional resolutions for the 3rd district for food heroes like we've seen today. And I'd encourage other board members to consider doing the same. So with that, may I have a motion to approve A36?
So moved.
And Madam Clerk?
Supervisor Hart,
Aye.
Supervisor Lavanino,
Aye.
Supervisor Nelson,
Aye.
Supervisor Williams,
Aye.
and Chair Hartman.
Aye.
Motion passes unanimously.
And may I now have a motion to approve the balance of the administrative agenda?
So moved. Second.
Madam Clerk?
Supervisor Hart,
Aye.
Supervisor Lavanino,
Aye.
Supervisor Nelson,
Aye.
Supervisor Williams,
Aye.
and Chair Hartman.
Aye.
Motion passes unanimously.
Thank you. And thank you again for being here. This is the first time we've been able to see real people in awarding a resolution for many months, and it's very gratifying. Now we turn to general public comment for matters not on today's agenda. Do we have any requests to speak?
Chair Hartman and members of the board, yes, we have 7 requests to speak on general public comment this morning. We are going to begin in Santa Maria with Tracy Baird in person, and then we will go to Zoom for Suzanne Peck, and then back to Santa Maria for Allison Wales. Tracy?
Hello, Chair Hartman. How are you?
Good morning.
And supervisors and those on Zoom. We are privileged to serve you as the Santa Barbara County Women's Commission. Today, we bring to you a national award that we received for Pass the Mic. On a national level, we were the only organization that received an award this year. So we're very honored and we feel very privileged to share this with all of you and to serve you as Santa Barbara County Commissioners. And we feel we do serve all of you. And I thank you all. And we were able to, the day after we received this, we were able to meet with Congressman Salud Carbajal and the Women's Commission and, just do a little photo op and let him know what we're doing also. So I thank you all for this. And we wanted to share this with our community. And we hope everyone sees Pass the Mic.
And will you tell us a little bit more about what it means? All right, thank you. Go ahead.
Be on next. A little out of order. So my name is Allison Wales. I'm the new chair here with the Commission for Women, and I'm excited to speak to all of you today regarding this award. Suzanne Peck, who developed the program regarding speaking with teens and LGBTQ issues and sexuality issues. It is so needed in this community. In my other job at the North County Rape Crisis and Child Protection Center, I worked with teens for over 25 years. One of the unique things with us is you're able to speak with them in a confidential way. And once you're able to have a safe, confidential space, teens have a lot to say. And this is what Pass the Mic is about. We are excited now with this award and the establishment of it to take it to our community, to local school districts, to other nonprofits, and other areas and other places like Boys and Girls Club, and partnership with Planned Parenthood, again, to provide that educational safe space for our local teens. Is Suzanne on?
Suzanne?
And we will now go to Zoom for Suzanne Peck.
Oh, that would be sad.
Suzanne, you can proceed with your comments. Thank you.
Good morning. Good morning, Chair Hartman and supervisors, members of the board. I'm very grateful for your support as we develop Pass the Mic. So just to give a little bit of background, you remember, some of you were there with us in 2017 when we started our Women Speak Up events countywide from Carpinteria, Santa Maria, Guadalupe, and everywhere in between, town halls with women. And the issue we heard the most about was sexual harassment, discrimination, sexual assault, assault on campus, and felt that this is something that we need to do something about, not just listen to all these teenage girls and women saying this is an issue in our community. So we decided to meet with the school district, meet with all the health teachers in the county, and talk about what we could do. And Pass the Mic was developed as a tremendous collaboration with the public health department. From the beginning, Dr. Charity Dean volunteered to work with me on the script and on medical review of the information that we were sharing. And Vondo Reynoso and Dr. Fitzgibbons and Suzanne Grimacy and the County Education Office. This was really a labor of love. And as my sister Commissioner Serrano said a moment ago, a culture of one. It was working together from everyone in the county to say, how can we create a documentary with high school kids sharing pearls of wisdom on these serious issues and make it okay to have these conversations. So we're excited about winning this award. If you haven't seen Pass the Mic, we hope you'll take time. I know, Chair Hartman, you were with us at some of the early Women Speak Up events, and Supervisor Hart, you've been at a couple of our community events when we've screened Pass the Mic and had a panel of health experts. So we're really excited about being able to now share this nationally, and winning this award is really something that we're proud of. And with the current release, we encourage you to continue to support the use with community health centers and so on. So thank you for your support. And if you haven't seen Pass the Mic, it's free. It's in wide release now, and we're thrilled to share it with the world. Thank you.
Thank you so much. Tracy, did you have a little more?
Yes, and this is our second time that we've won a national award for the Santa Barbara County Women's Commission, and that we like to share our product throughout California. So we're very happy to have done this and working with Santa Barbara County and with you all.
Well, thank you and congratulations. We know that you're among our star committees and commissions, but now what you're doing is being shared nationally and recognized nationally and bringing attention to really critical issues. So thank you so much. And Supervisor Hart.
Yeah, I just want to say thank you too for coming and sharing this really great news. Ms. Beard, Ms. Wales, and Ms. Peck, you're doing such a fantastic job, and getting that national recognition for Pass the Mic really validates the creative work that you've done to create this safe educational space for teens to talk about identity and sexuality. And it's really valuable in our community. And now it's a national model for everybody to replicate around the country. So thank you for your leadership.
Thank you. Thank you, and we'll continue to listen.
And Supervisor Williams.
Just want to encourage the commission. I have seen all of you work to bring the commission's work to another level. And I think it's important. It's particularly important in times when we can't meet face to face, but even more so, hopefully, where we can. So I hope you will continue the great work of the commission.
Oh, and that being said, we have 3 positions open in District 4. Oh, sorry, District 4. So we'll be looking out and recruiting, just to let it know.
All right. Thank you. Okay, turning then to our departmental agenda. Madam Clerk, would you read item 1 into the record, please?
Chair Hartman and members of the board, we still have a few more requests to speak on general public comment.
Sorry. Thank you.
No
I'm
worries.
a little rusty at this.
No, it's okay. And I do have a couple quick announcements before we proceed with the remainder of our general public comment. I would like to note for the record for members of the public who are participating in our meeting today, our simultaneous Spanish interpretation is now up and running. So that has been fixed. So apologies there for the delay this morning. In addition, I would also like to remind members of the public who are participating via Zoom, we do not use the raise hand feature for our Board of Supervisors meeting. I am monitoring and we do have a list of those speaking. If for some reason we do skip over you, you can always call the clerk of the board's office for any complications or issues you might be having, but just a friendly reminder, we do not use the raise hand feature. Thank you. And we will proceed with Leslie Weinstock to be followed by Ann Odile Thomas. Leslie, you can begin your comments. Thank you.
Yeah, Cell phone radiation has been proven by the National Institutes of Health to cause cancer. The Environmental Working Group has just released shocking findings of a new peer-reviewed study on cell phone radiation. Their scientists found that the FCC's current regulations are woefully outdated and unsafe. They called for new cell phone radiation standards. The major breaking news happened last Friday. The DC Court of Appeals ordered FCC to explain why it ignored scientific evidence showing harm from wireless radiation. Regarding the FCC exposure limits, the court said, quote, "Finally, we find the Commission's order arbitrary and capricious in its complete failure to respond to comments concerning environmental harm caused by radio frequency radiation," end quote. That's the good news. The bad news is that the state wireless broadband bills, SB 556 and AB 537 are passing. They will deregulate the industry and destroy all local authority. This will allow 5G antennas on every pole and every streetlight within a few feet of our bedrooms, posing fire and safety hazards, lowering property values, and threatening health. The telecoms are using the tobacco playbook and disinforming the legislators. These bills absolutely do not bridge the digital divide for unserved and underserved populations. The solution to bridge the digital divide is affordable and accessible to all municipal wired broadband, 10,000 times faster than wireless, safer, less hackable, less expensive, vastly more energy efficient, more secure, reliable, and will protect our property values and reduce fire risks. Once these terrible state bills are passed, they will override all local authority. Therefore, our only hope is for you to take action before they pass on the floors, and that will be around August 28th or before. The paramount first step to take is to reverse the two code crossouts from December 2019 that prohibited WTFs in residential zones and required proof of a significant gap in coverage. The other step to take is to pass an urgency ordinance based on a stellar ordinance review analysis that SafeTech SBC received today from our legal expert and will be happy to provide to you. These are dangerous bills, and
Thank you, Leslie. That is your time.
meeting with you soon with our new experts.
We will now proceed with Ann O'Dial Thomas, to be followed by Joyce Ellen Littman, who is our final speaker.
Good morning. Can you hear me?
Yes, we can. Please
Wonderful.
proceed.
Thank you. Good morning. I am a longtime county resident, and I'm calling on behalf of Safe Technology for Santa Barbara, which I have done a number of times already over at least the last year. I am on my way to dropping my daughter off to school this morning. I got my daily dose of microwave radiation along the way. I counted no less than 10 small cell towers and antennas on my short 10-minute drive, each one of them exposing me and others to harmful microwave radiation. One of them, recently installed, is placed within 30 feet of someone's bedroom window. This has been allowed thanks to the crossout that this board allowed back in December 2019 in the county telecom ordinance that now allows wireless company to install harmful small cell towers in residential neighborhoods. I want to inform you that just last week, in a huge historical decision, the U.S. Court of Appeal for the District of Columbia ruled that the FCC failed to report evidence that exposure to RF radiation at levels below the Commission's current limits may cause negative health effects unrelated to cancer. Further, the agency demonstrated a complete failure to respond to comments concerning environmental harm caused by RF radiation. We have been asking you for over a year now to reinstate the protection for county residents, and you have failed to act on this. Meanwhile, Two state bills, SB 556 and AB 537, which might get voted on the floor over the next few days, will give a blank check to the industry to install their towers on every utility pole in California, including right in front of your own home. Because of the crossout that you allowed in our ordinance, county residents will have zero protection left against the abuses from the industry. You have the power to protect the county residents, and I urge you to take action before it is too late. Please immediately remove the crossouts from the county ordinance and update it so that the residents are protected from this harmful microwave radiation. Please protect the residents, not the profits of the wireless telecom industry. Thank you.
We will now proceed to our final speaker, Joyce Ellen Littman. And Joyce, you can proceed with your comments. Joyce, I have unmuted you on our end. You just need to unmute on your end and you can proceed with your comments. Chair Hartman and members of the board, it appears that Joyce may have stepped away from her computer, so that concludes public comment.
All right, thank you, Madam Clerk. So now we turn to our departmental agenda and item number 1.
Chair Hartman and members of the board, departmental item number 1 is from the County Executive Office. It is a hearing to consider recommendations regarding an update on the coronavirus disease 2019 COVID-19.
Good morning, Chair Hartman and members of the board. May I have my slides, Madam Clerk? Next. With me this morning is Dr. Henning Ansorg, our County Health Officer. Our briefing this morning includes a recap on COVID-19 data, some update on the booster shot, update on Delta variant, and we'd like to end with some comments from 2 local hospital providers. Before I get started, I'd like to pause and appreciate our partners in the healthcare system. We are so fortunate here in Santa Barbara County to have so many accomplished professionals in our broader medical community joining hands with the public health team in responding to COVID-19. These accomplished individuals in public health and the healthcare community are trained professionals who are committed to protecting the health of our community. They are dedicated to preventing further impacts and pain caused by this pandemic, and they are using their expertise and skills to save lives. A huge thank you from me and the Public Health Department. Next. This is a chart displaying case rates by vaccination status as of August 6th. Our daily case rate on August 6th was 15.8 per 100,000. However, when we drill down, we see that the rate is 25.4 per 100,000 among unvaccinated individuals and a low of 6.9 per 100,000 among vaccinated individuals. So the takeaway is that our cases were nearly 3.7 times more likely to be unvaccinated than vaccinated. So this is a call for vaccination. Next. This chart presents the 7-day rolling sum of new cases by area, and it is an effective way to represent the COVID-19 in geographic area without the noise generated by the high variability in daily case counts. So as of August 12th, we continue to see 4 areas with increasing cases, and these are higher cases than the rest of the county. So the top is the gray line representing Santa Maria at 200 cases. The orange line representing Santa Barbara at 125. Next is the yellow line representing Lompoc at 119. And the blue line is represents Orchid at 92. And the rest of the areas are lower in new cases. And I'd like to pause here and remind your board that this data is available on our website. And this is where I heard earlier comments, misquotes of death rates of cases, and just wanting to ground everyone that for real data, for vetted data, please refer to the cases and the reports on our website. Next. This is a snapshot of Santa Barbara County by the numbers. Yesterday, we reported 71 new cases. And so this is a slight decrease from our 2-week average of 104. We did not report any new deaths yesterday. We have 800 active cases in our county right now, with 56 hospitalized, and of the 56 hospitalized, 12 are in the ICU. We have a total case count of 37,454 and a total death count of 470. Our case rate per 100,000 as of August 12th is 23.3. Our testing positivity as of August 12th is 8.7. Next. These are 2 charts describing our hospital capacity as of August the 16th. So as our cases increase, we worry about the capacity of our local hospital system to care not only for the COVID-19 patients, but for patients with other critical medical needs as well. Currently, we have 64.5% of the hospital beds in use, which means that we are at the cusp of being in the red zone, which is when we have less than 35% bed capacity. The other graph describes our staffed ICU beds in use. Currently, we have 77.6 of our staffed ICU beds in use. So for this metric, we are also at the cusp of being in the red zone, which is when we have less than 20% available. So we are worried about this trend and are keeping our eyes on our hospital capacity. Next. With regards to COVID-19 hospitalization, so this is data from May and June. From the available data for May and June, we had 54 hospitalized patients due to COVID-19. Of this number, 89% were vaccinated. 89% were unvaccinated, and 11% were vaccinated. With regards to the 6 hospitalized patients who were vaccinated, these individuals may have been admitted due to comorbidities or other medical needs. And we are going to be looking into the percent of vaccinated hospitalized patients. And Dr. Fitzgibbons will have a more updated number of hospitalization for Cottage Hospital. And we anticipate within a few weeks to update countywide the July hospitalizations. Next. As of yesterday, we have 63.3% of our eligible Santa Barbara County as fully vaccinated. And again, here is the bottom line. The bottom line is that there are still 142,006 individuals who are eligible to be vaccinated, but have yet taken the opportunity. Next. Outbreaks. This is something we are seeing an uptick in outbreaks, reflective in the cases that I showed you earlier. Currently, we have 33 active outbreaks throughout our county. Public health is monitoring each of these cases, situations to mitigate further spread of COVID-19. And these outbreaks are occurring in a wide array of businesses, congregate settings, as well as education. Next. Next. As you may have heard, the FDA recently approved the booster shot for immunocompromised individuals. Booster is available as a third shot for Pfizer and Moderna vaccines only. California is estimated to have 700 eligibles for the third shot. Here in Santa Barbara County, we are estimating roughly about 13,500 individuals as eligible for the booster shot. Current vaccine providers and the pharmacies that are existing are sufficient to deliver the booster shot. The booster shot will require self-attestation by individuals. So individuals will need to self-attest that they are receiving active cancer treatment for tumors or cancers of the blood. They are attesting to receiving an organ transplant and taking medicine to suppress their immune system, or that they have received stem cell transplant within the last 2 years, or taking medicine to suppress their immune system, or have moderate or severe primary immunodeficiency, or have advanced or untreated HIV infection, or have active treatment with high-dose corticosteroids or other drugs that suppress their immune response. And we are working with our provider community with regards to the process, and we'll be updating our provider community as we hear updates from the state. Next, I'd like to introduce to your board Dr. Ansorg, who will be presenting the next few slides on the Delta variant.
Thank you, Dr. Reynoso. Good morning, Chair Hartman and members of the board. Next slide, please. Next slide, please. Everybody has heard about the Delta variant. It's a combination of several mutations that originated somewhere in India earlier this year, and it made its way to Europe and to the United States. It has a shorter incubation period than the previous form of the virus, which means that it starts to infect people faster. And unfortunately, even vaccinated persons can get infected by the Delta variant, mainly because it attacks the local immune system so rapidly that the antibodies are basically outpaced, and they can only start clearing the virus once the antibody response is really ramping up in the system. The virus may be shedded a little bit longer, and mainly in the unvaccinated. Vaccinated people seem to clear the virus after about 5 days, even if they get infected. We have also seen that the Delta virus seems to have much higher viral loads, which means there's more viable virus in an infected person. And we can measure it by CT values on the PCR tests. Next slide, please. In May, on May 1st, actually, we saw the first 2 cases in Santa Barbara County with the Delta variant. Those were travelers from India, and both of whom had been vaccinated with the AstraZeneca vaccine in their home country. They became symptomatic shortly after arrival in Sacramento and were tested and found to be positive. They did not require hospitalization, and they're isolated immediately, and no further contacts were infected, fortunately. In June, our sequencing testing with UCSB and the state showed that we had over 50% of the samples that were sequenced during June were already Delta. At that time, the old UK variant, now called Alpha, was already receding, and we had very rare Gamma and no more Western Coast or California type viruses at that time. As of July, we tested a lot of samples for variants, and Delta made up way more than 95% of every single sequence sample in Santa Barbara County. This is consistent with the state, and it is consistent with national trends. Unfortunately, we did now start to see breakthrough cases. They were no longer rare, but more common. Next slide. This is a picture of Provincetown around July 4th, where a lot of festivities took place, and it was an outbreak was reported that got everybody's attention because this outbreak for the first time showed the effectiveness of the Delta variant on even vaccinated people. Initially, 469 people were identified, and 3/4 of those in the beginning were actually vaccinated folks. Now, there's a lot of limitations to this study. However, it gave us very good information on what to look out for with Delta and how infectious it is. Next slide, please. So a few data on the epidemiology of this Delta variant. As I mentioned earlier, the virus gets spread for a longer period of time, and more people get infected. The term that we use in medicine and epidemiology to confer the contagiousness of a virus is R naught. And when the R naught number is 1, it means that one infected person infects one other person. Now, our previous type of the COVID virus had an R naught of 2 to 3, which means one infected person infected 2 or 3 other people. This new Delta variant now is much more contagious for various reasons. And the R naught is believed to be anywhere between 6 and 7. So my slide is already incorrect. We are considering it around 7. That means one infected person can infect 7 others on average. Now, for comparison, the regular flu virus has an R naught anywhere between 1 and 2, which means one person with influenza infects 1 or 2 other people. And chickenpox has anywhere between 8 and 10. And this means that this Delta variant is really approaching contagiousness of chickenpox, which is very significant and concerning. Fortunately, the vaccine are still very effective at keeping people alive and also keeping people out of the hospital for the most part. Dr. Fitzgibbons will talk a little bit more about that. We are seeing less severe cases. Many vaccinated people have more milder symptoms when they indeed get infected, and they fortunately clear the virus faster than unvaccinated people. Next slide, please. In the beginning, we said that we were very hopeful to anticipate a rapid drop of our current surge. And we related that, I mean, our hope was grounded in the findings in England. They had a very significant surge, as you can see that to the right on the graph here. They saw this huge surge in starting in early July, and at some point around mid of July, there was a rapid decline. It is unfortunate to see that subsequently this decline plateaued and actually is on the up swing again. So please understand that the Delta variant is very, very new, and we are grappling to get new information. So whatever has been published last week is already probably outdated, and we have to constantly accommodate for that and come out with new information. So there are modeling. There are models out there that predict or foresee that we may only see our peak of this current outbreak in October. So I wanted to share this, that we can no longer really rely on the findings from England. Next slide, please. Next slide, please. So we are very grateful to have Dr. Chuck Merriff, emergency room physician from Marion Hospital, and Dr. Lynn Fitzgibbons, infectious disease physician at Santa Barbara Cottage Hospital. And they will give us some more information from their perspective. Thank you very much.
Thank you, Dr. Ansorg. I'm the Chief Medical Officer at Marion. I'd like to start off by thanking all of the people, the community service people that were acknowledged earlier in this meeting. As we all know, healthcare goes way beyond the walls of our hospitals. And thank you from our hospital and my point of view for all of the service that everyone has done. Thank you. I will say that at Marion, our numbers support the numbers that Dr. DiRenoso showed. We've, as of yesterday, had 44 patients in our hospital as inpatients, 13 of which were in our intensive care unit. So we are seeing a lot of disease and severity of disease as well. And I think her graphs also show that we've seen more in the North County than we have in the South County. What we would like to promote to prevent this spread, which Dr. Ansorg eloquently stated is much more contagious than the previous variants, is to promote not only vaccinations, which clearly make the disease more tolerable, but also the use of masking. And I'm in my office alone, so I'm not masked, but indoors, where the virus is clearly more transmissible, we really want to promote masking for people. We in our hospitals are masked everywhere in the hospital, with the exception of if by yourself. And so I would really like to promote to everyone listening the use of masks, which is a way to protect not only yourself, but those around you. Thank you very much.
Dr. Merrill, and thank you to the board. Thank you to the CEO's office. But I'll actually just take 10 seconds to duplicate Dr. De Reynoso's example of starting with a gratitude. I haven't actually had very many opportunities to publicly thank Dr. De Reynoso and Dr. Ansorg for all that they have done, but I have had a front seat view of the last year and a half. And I know that much of it has been on public display, but much of it has been just the tireless work behind the scenes. And I'm very grateful to be able to say that our county is in the hands of excellent doctors, but also fundamentally fantastic people. And so thank you to both of them for that. I'd love to go to my first slide then. And touch on the next slide, please. And just mention a couple of perhaps comments on vaccines, breakthrough cases, and boosters that Dr. Ansorg already alluded to. So I think we're all aware that every media cycle we see a new study, a new version of data that tells us just how good these vaccines are. And one of the challenges has been that every one of these studies is doing, very different work, whether they are working in a lab, looking at what are called neutralizing antibody levels, or looking perhaps in real life results in real people. Even real life results in real people are often comparing apples to oranges, depending on what your threshold is for testing, depending on the timing of vaccination rollout in a specific community or country. All this to say, I think we're, again, very fortunate for our local expertise to be able to really drill down locally and help to answer some of these questions. Locally, of course, we have used the 3 EUA available vaccines listed here, Pfizer, Moderna, Johnson & Johnson. But ultimately, as in the weeks ahead, we do continue to see new reports on vaccine efficacy or how well the vaccines work. Please do remember that these are often very difficult to compare with prior studies because there are just so many variable factors to consider. So what I focus on, and I think some of you have heard me say this in recent weeks, is I really try to focus on the recurrent themes. And our public health experts, our public health officials have already told us those themes. Those themes, remember, are that our vaccines continue to prevent severe disease, hospitalization, and death. As we said, and I put a period at the end of this sentence to just emphasize that this is true, unfortunately. Vaccine breakthrough cases occur with the Delta variant. We wish that were not the case, but we know it to be the case. The good news is we know, again, that these are not severe cases, hospitalized cases, or deaths for the most part. The main question, I think, for many of us right now is understanding if you have a breakthrough case, if you are one of those unlucky ones. Everyone remembers Dr. De Reynoso showed us, just how disproportionately the unvaccinated group is compared to the vaccinated group. But if you're in that unlucky group who do develop a vaccine breakthrough infection, how infectious are you? And as Dr. Ansorg mentioned, perhaps our best data on this, and in fact, the study that we think really informed the national shift in policy on indoor mask usage was, of course, what happened in Provincetown with the information that the viral load, essentially how much virus an infected person has when we do the swab. We thought previously and hoped previously that people who were vaccinated with a breakthrough infection had lower viral load, because that may mean that they're less infectious. Unfortunately, what happened with that very important MMWR study is that we learned that while it's less likely that a vaccinated person will become infected, if they do become infected, those viral loads are pretty high in both the unvaccinated group and, unfortunately, that smaller number of vaccinated breakthrough infections. So I think it's important then to think about what does this mean with infectivity? And we actually have some newer data on this quite recently. And I think an important part of the story and how we can reconcile that with the idea that, again, vaccinated people with breakthrough infections are likely to be less sick, but also less likely to be infectious. And this data comes out of Singapore. This data is actually, it's a pre-publication. And so we'll look forward to hearing, the review and hopefully a full publication to come in the weeks ahead. But what we have learned is that while breakthrough infections have high viral loads, just as unvaccinated infections have high viral loads, how quickly those viral loads drop depends on your vaccine status. And in fact, people who have breakthrough infections after a vaccination, while they might at the beginning have a high viral load, they quite quickly become much less infectious with less viral loads. And again, this is an important question. It's an important part of, I think, a lot of our local public health policy. But I think another, for me, as I hear this, yet another reason to continue to reiterate that vaccinations truly are not just a way to prevent severe disease and death, but truly a way to get a handle on this infection, on this surge in our community. And then finally, Dr. De Reynoso mentioned booster vaccines and described, she did more than mention, she clearly described the new policy, the national policy, because unfortunately we know that protection from these vaccines is not as long-lived as we wish. And of course, we now have on last Friday, we have the recommendation from the CDC's ACIP to proceed with booster vaccines for those who've received an mRNA vaccine, Pfizer or Moderna, with a third dose. And Dr. De Reynoso carefully went through all of the indication for who qualifies as truly immunocompromised and qualifying for this. We've also heard just in the last 12 or 14 hours, some indication of perhaps even some national level changes that may be coming in a more global way with regards to booster vaccinations. And I know that there is a lot of discussion locally and nationally about this. And I think we all look forward to hearing more about this. Next slide. I'd like to then, just for my last two slides, show some very specific data from Cottage Health. And a thank you to Hannah Hussein, one of our senior analysts, who follows this data incredibly carefully and has provided us with this slide. What we see here is the number of COVID admissions by week from May until last week. And you see the breakdown, the color, is a function of vaccine status. And what you see overwhelmingly, of course, is that the blue color, those who are unvaccinated, really make up the majority of our COVID admissions by week. I'll make a very clear point, though, that this data is based on who had a positive COVID test when they were admitted to the hospital. And so what that means is if someone comes in with a fractured hip or perhaps having been in a motor vehicle accident and they're incidentally found to be COVID positive, they're included in this. And what does that mean from an infectious disease perspective? It means it's probably slightly slanted in the direction of not really showing the true benefit of the vaccines in preventing severe COVID-specific hospitalizations. Nevertheless, we still have 80 to 90% of our COVID-positive admissions to Cottage Health in the last 3 months have unfortunately been in those who are unvaccinated, the trend that we're seeing regionally and nationally. Next slide. And then I'll just finish up with this slide. Some of you may have seen, I shared it last week in a webinar, but we've actually extended it. Thank you to Mr. Brett Tandy, our CFO at Cottage, who has worked on this and provided me with yet another update of it. And so if you'll just follow me on what this graph shows. And I think some of you remember I used to be a high school physics teacher, so forgive the graph, but if you follow on the x-axis, the bottom axis there, basically telling us how many recent positive tests we've seen at Cottage through our Pacific Diagnostic Lab, and then on the y-axis, how many admissions we had, you can see every single one of these dots represents a day. The blue dots are days during the winter surge. And so what we saw, and it makes sense, is that as we had more COVID positive tests, as we moved to the right, there were more admissions to Cottage in a week. And that correlation makes a lot of sense. What's so interesting and what we've been following so closely as we try to make our own predictions for what's ahead for our own hospital resource strains is what's happening with the red dots. The red dots here are showing you the Delta surge. The red dots here are just the past 30 days. And what's so very interesting is while there's clearly still a trend as the number of, COVID positive tests we've had in the past week rises. So does the number of hospitalizations on the y-axis on the left there. But what's interesting is that the line has shifted down. In other words, on any given day, if we had a certain, or any given week, if we had a certain number of COVID positive tests, we, during this Delta surge, are seeing less hospitalizations than we would have at an equivalent level of new cases during the winter surge. So why is this? And there are lots of theories about this, and it's probably a variety of things. It's probably that we are thankfully doing more testing. We're capturing more asymptomatic or mildly symptomatic cases in the community. It's possibly also the case that we have more cases in the community who are thankfully less likely to become severely ill. They have that good vaccine protection, or perhaps they're fundamentally more young and healthy and less likely to need to come into the hospital. And there may well be other factors, but I think important for, again, internally our predictions ahead with regards to the impact of the Delta surge on the hospitalizations, and also I think important for us to follow as a community. And so I'll go to my last slide and just conclude with two final comments. The first is, although we've said it several times, but just to reiterate, expanding vaccination in our community is the best protection that we have against what's ahead. Grateful to everyone who's worked on this and continues to work on this, and really encourage anyone who is unvaccinated to please do whatever you can to find the information that you trust to inform your decision and help our whole community and you and your family get better protected. I think secondly, just to reiterate the importance of mask use indoors. We know that the Delta virus, as Dr. Answerk pointed out, is really in many ways a different type of disease, a different epidemic, a different problem. And we know that when we wear masks, we know that we mitigate or reduce the amount of aerosolization of that virus. Dr. Answerk showed something critically important when he showed us that the R naught value has jumped from 2 to 3 to 6. Just to give context of what that number means, that number, if we have 10 transmissions on with something that has an R naught of 2 to 3 compared to an R naught of 6 or 7, we're talking after 10 cycles through a population, we're talking about a difference between a few thousand cases starting with one case versus tens of millions of cases. And again, I think just important to really understand that the Delta variant is certainly bringing new challenges, but I think fundamentally we're ready. I'll hand this back to Dr. De Reynoso, I think.
Thank you, Dr. Fitzgibbons, and thank you, Dr. Merrill and Dr. Answerk for joining me on today's briefing. And that concludes the briefing from our Public Health Department, and we are available for your questions.
Thank you, Dr. De Reynoso. And special thanks to Dr. Merrill and Dr. Fitzgibbons, your trusted voices in our community, and it's great to have you here. Dr. De Reynoso, will they entertain questions from the board?
I believe that both Dr. Fitzgibbons and Dr. Merrill are able to make comments with regards to the boots on the ground from their hospitals, as well as their expertise as medical providers.
Great, thank you. So I first see a light from Supervisor Hart.
Thank you, Madam Chair. And I want to express my thanks to Dr. De Reynoso and Dr. Answerk and Dr. Fitzgibbons and Dr. Merrill for being here today to help share this really critical information. And they're really representing the entire medical community in Santa Barbara County today. They're standing up for the folks who are working nonstop for the past 17 months, protecting us. And those folks don't get enough recognition. They're working diligently 24/7. And one of the really difficult things about the public response to this virus is that what's happening in those hospitals is largely invisible to us. You know, we have this opportunity when these medical professionals join us, you know, to get their insight into the work that they're doing and the things that they are seeing on a daily basis in the hospital. And I think that has been a real communication challenge for us and everybody in public health, is to help the regular public understand, what it is like for somebody in the hospital trying to treat patients that are struggling to survive this really serious illness. There's a lot of information, and we've all gotten very tired of this pandemic. It's exhausting emotionally, physically, for everyone. And yet the consequences of it are very abstract and distracted from us and our lives. So I hope that Dr. Merrill and Dr. Fitzgibbons could put a human face on that and help amplify, the message and the urgency of the experiences they have on a daily basis working with patients that are in the hospital.
Thank you, Supervisor Hart. Supervisor Williams?
Well, I want to echo Supervisor Hart's comments and be a voice of encouragement. And we really appreciate the many hours that all four of you and your staffs are putting into fighting this pandemic. I'm just hoping that they'll both be staying till after public comment because I think we're still in the midst of trying to convince some folks in the public either that vaccination is the right course or to prioritize the time. It's a mix of folks. Not all are vaccine hesitant, but I really think that they need to hear from you, especially after some of the public comment we may have briefly.
Supervisor Nelson?
Yes, thank you. I just had a question for Dr. Merrill or Dr. Fitzgibbon. And first of all, I wanted to thank both of you for being here. As a resident of the Santa Maria Valley, I know Dr. Merrill is thought of in all circles highly, and all the work you guys are doing at Marion Hospital. You guys have a lot to be commended throughout this pandemic. And Dr. Fitzgibbons, I've heard nothing but good things about you from many of my South Coast colleagues and businesses and stakeholders down there that are working with Koch Hospital. So thank you both for being here. A question that I've been trying to find out is, of the unvaccinated cases that you have in the hospital, are you guys finding any of them below the age of 12 that were not eligible for vaccines? What does that look like? That's because I think that's something helpful for the discussion when we're trying to figure out, how to move forward with this.
So thank you for your comments. We have not seen any pediatric patients at Marion as of yet. I'll defer to Dr. Fitzgibbons for their experience.
Thanks, Dr. Merrill, and thank you, Supervisor Nelson. Your comments are much appreciated. Unfortunately, we have had pediatric cases. We've had pediatric cases really throughout the pandemic, including in recent weeks. We've had both adolescents above the age of 12 who would have been vaccine eligible, and we've had those below the age of 12. What we have really started to discuss is what we are seeing across the country. And what I mean by that is, unfortunately, we are hearing and seeing children's hospitals and hospital wings for pediatrics that are really suffering from an really as yet unseen epidemic of pediatric cases. The good news is that most kids get mild disease. The problem, as I said last week, is a small percentage, a very small percentage of a huge number is a medium-sized number. And so I want to be very clear, again, to piggyback off perhaps a couple of the other supervisors' comments. We're grateful for this appreciation, but we're exhausted. And our staff is working so very hard right now, including even today, engaging in discussions as to how we are going to care for the potential for an influx of pediatric cases. And man, I wish that we weren't having to talk about that right now. I'll actually use that to just because, again, just my final comment on this. I warned you I was a high school teacher. I take the mic and I don't give it up. But my final comment on this is just tremendous gratitude to not just Dr. Ansorg and Dr. Dervinosa, but their whole team at the Public Health Department that is working so closely with Superintendent Salcido and all of the superintendents across the district to make sure that with school restarting this week, and so exciting for so many families, so many districts, but just doing whatever we can to avoid the bump in cases that we are anxious could be ahead if we don't get it right.
Thank you, doctors. I have a few other questions for Dr. Ansorg. The first one had going back to slide 4 of the presentation. that Dr. Reynoso had about the case rates for vaccinated versus unvaccinated in the county. And I was wondering if you believed, or if it's possible, the reason why our case rate is so low in vaccinated individuals is potentially because a lot of them aren't getting tested because they're asymptomatic. So that in fact, we actually may have quite a few more vaccinated people who actually have COVID in our community, but are really unaware that that's the case.
Supervisor Nelson, 2 comments. I agree with the assessment that we may undercount vaccinated people who would test positive if they were to test. However, there are also data, there are studies out there from out of Scotland and out of Israel that show that the COVID vaccines, especially the Pfizer and Moderna vaccine, actually protect the vaccinated person from even getting infected to a significant degree, anywhere between 65 to 80%. Now, again, those data have been out for like 3 weeks, so they may change. Everything changes so quickly here. But there is definitely evidence that fully vaccinated people get infected less frequently.
So, and that's what I'm trying to figure out, or at least ask some questions about to kind of tease out. So we're talking about the R naught, which is the transmissibility frequency. Is there any look at what the transmissibility for a vaccinated versus unvaccinated individual might be? Is it 6 or 7 for the unvaccinated, but 2 or 3 for the unvaccinated, or is that an average of the two? How's that been teased out?
Supervisor Nelson, the R naught relates to the virus, not to the vaccination status. So it is the ability of the virus to infect people on an epidemiological status. I don't think, to my knowledge, I've never seen anywhere a differentiation between the R naughts between vaccinated or unvaccinated people. That's it is a delineation of the contagiousness of the virus.
Okay. So it could be just as contagious in a vaccinated versus unvaccinated individual.
Correct. That's also why we say, the R naught for chickenpox is 10. And many people are vaccinated against chickenpox. So we don't say R naught is 10 for unvaccinated and 12 for vaccinated or anything like that. So that is never being reported. So the virus is much more contagious. And that's unfortunate for us. But fortunately, the vaccines are still very helpful.
That's very helpful for me to understand this. So thank you, Dr. Hansorg. One last question, because there's a big conversation going on in our community about masks, obviously, and the efficacy of masks. I don't doubt at all the efficacy of masks, especially in like a hospital setting. But are we seeing any type of, is it the real life setting, maybe the non-medical setting? Many households that maybe have a basket of masks sitting there. Are we studying that or looking at? Because I would imagine at some point masks can actually be counterproductive if it's you have the right type of mask hygiene or whatnot. So are we looking at that at all? Is that something that you can comment on? Dr. Hansorg, you're muted.
Apologies, I was unmuted, my difficulties. So I think mask hygiene was a big issue in the beginning of the pandemic when we were still thinking that the virus would also spread through surfaces. We are much less concerned about that because it's an airborne disease now, especially with the Delta variant. So we are less concerned about that. Any mask will help. However, obviously an N95 respirator or a surgical mask that is frequently used tight to the cheeks and over the nose is more protective for the wearer. There's a lot of evidence now that mask, especially indoors, is really a very highly protective measure. And it's obviously not as good as a vaccine. But I think it's what we need to do when we have this significant increase in community transmission. We need to sort of try and find something that will not impact people too much in their daily lives, but has a good effect in preventing the spread of the virus. And that's why the indoor masking seems really important.
Thank you.
Is that your final question, Supervisor Nelson?
Yes, Chair Hartman, thank you very much.
Supervisor Hart?
Yeah, I just wanted to go back to a point that Dr. Fitzgibbons was making about young children and the best things that we can do to protect them as we go into the school openings. And it's so important to get kids back in school for all the reasons that we all intuitively understand. But at the same time, all of us have an obligation to do everything we can to protect the children that can't get vaccinated. I mean, that isn't even an option if you're under 12 years old. So all of us assume a larger burden in the community to protect those children as they're going to be gathering in schools. And, the two strategies that we have that are the most effective are vaccinations and masking. And I just think it's so critical to have Dr. Fitzgibbons and Dr. Merrill re-emphasize how important this is for everybody to continue to press for more people to get vaccinated in any way that makes it easy for them, make it accessible, make it convenient, make it popular, and have everybody kind of understand that they have a role to play and that the behavior of wearing masks indoors around other people is also critical to that, to stopping the spread of an extremely infectious variant. I've heard this narrative that, that the public health messaging hasn't been consistent through this pandemic. And I think the reason for that is because the challenge hasn't been consistent. Circumstances have changed over time. This variant is a different thing than what we were fighting with earlier in the year. It's much more infectious. The stakes are higher, and we have these simple and really effective tools that are available to help everybody together protect each other. So if Dr. Fitzgibbons or Dr. Merrill want to talk about that relationship between public health, all of our agency doing the right thing and protecting each other, and the ultimate result in protecting children, I'd love to hear their thoughts.
I'd like to thank this group for having this be a subject of interest and letting us participate, because I think educating the community is the best thing we can do. One thing that wasn't said about masks is that this is not the only virus out there. And this year particularly, we didn't see much influenza at all. And so it also protects people against some of the other pathogens that are out there. I'll give it to you, Lynn, for further.
Thanks, Chuck. Yeah, I absolutely agree. And thanks, Supervisor Hart, for the question. I think to be thinking about what can we do to protect children for these next few weeks ahead. I think a couple of thoughts. I think first, we're all well aware that this is not coming and going, and it's not what we hoped it would be back in April of 2020. This is our children's lives. This is their development. Keeping them, thriving, learning in school, as I say, butts in seats in the classroom is really a top priority, but also doing so safely. And so I think, masks. I wish my kids didn't have to meet their teachers this week wearing a mask inside their classroom, but I'm so grateful that they are, because I know that it is going to keep them and everyone in their classroom safer. And I know that it's going to keep them learning through September and into October, and hopefully, and on and on. I think, when they're outside, I'm thrilled that they are going to run around breathing their own air, hopefully not sharing air with others, but without a mask on, and seeing the smiles of their friends, seeing those new braces go on, and enjoying some freedom from the masks. But that doesn't take away from how critically important those masks are in keeping our kids safe inside, particularly inside their classrooms. So I think that's my perspective on masks and kids for, especially this important week ahead.
Dr. Fitzgibbons, could you talk a little bit about long COVID and if we know anything about that vis-a-vis children?
Thanks. Great question. So long COVID, for everyone to remember, is what we think of as the set of symptoms that unfortunately some people are getting after they recover from their acute COVID-19 infection. And again, unfortunately, what we've seen through the pandemic is that a fair number of people, I mean, again, there's a lot of variability in these studies, but a lot of people are unfortunately developing a range of symptoms. It ranges everywhere from, brain fog to excessive fatigue to respiratory symptoms, and indeed even damage to the lungs in some cases. And so I just wanted to reiterate what I think Supervisor Hart said a minute ago, and Dr. Ansorg has said so many times. The Delta surge is really its own pandemic. It's behaving differently than everything before. And also to kind of echo the important point that was made, which is that I am grateful our public health officials locally and nationally have not stuck their heels in on any one policy that they decided a year ago, but rather have moved as we have learned more. This pandemic has been dynamic, and so too would we hope and expect our public health recommendations to also be dynamic and to adjust in a way that keeps us as safe as we can be as information changes. And so all this to say, with long COVID and the Delta variant, I have to tell you honestly, we don't know. We don't have any reason to believe that the percent of people that develop long COVID after Delta should be different than after the prior variants. But I'll be able to tell you that in November, December, once I've seen, again, unfortunately, a lot of people suffer from this current surge and then see how they do. Then when we think about children, again, unfortunately, we do know that a very small percentage of kids do develop long COVID. Our local pediatricians have been dealing with this for over a year now. If you talk to any of them, they're seeing patients who had COVID and then are, still struggling with fatigue or with some of these other symptoms, maybe difficulty concentrating in school. And so I think the point is, and the question is much appreciated. And I look forward to learning more. I certainly hope that we continue to see very, low percentage of long COVID in pediatrics, but I worry that with this potentially big surge of cases in kids that we may be facing, I do worry again that even a very, very small percentage of a big number could be some kids who are suffering from long COVID down the road.
Thank you, Dr. Fitzgibbons. I think with that, I don't see any more board members with questions. Although if I know you're very busy, but Supervisor Williams mentioned if you could stay and respond to some of the public comment, if you would like to, we'd certainly welcome that. So turning to public comment, how many speakers?
Chair Hartman and members of the board, we have 9 requests to speak from the public, and I would like to note we do have 2 members of the public who have requested to speak via Zoom virtually and have not signed in. So if you are a member of the public and you have registered to provide public comment on departmental item number 1, now is the time to log in and do so. Thank you. And Chair Hartman and members of the board, I do just have a quick announcement before we proceed. I know we do have quite a few members of the public on Zoom as well as in person today for departmental item number 4. And just to provide a quick update on departmental item number 3 and 4, that will be after our closed session agenda this afternoon and after lunch. And we are estimating that departmental item number 3, that is from Community Services, which is a hearing to consider recommendations regarding approval of the first fiscal year 2021 through 2022 action plan substantial amendment, will be taken up around 1:30. That will be the earliest. And departmental item number 4 from the County Executive Office and Public Works, which is a hearing to consider recommendations regarding the development of a countywide community workforce agreement, will be the next item up after that. So perhaps the 2 o'clock or 2:30 hour. So just an update for the public. I know we have quite a few people here for those items. And we will proceed with public comment to begin with Maria Kastner, to be followed by Thomas Becker. And Maria, you can go ahead with your comments. Thank you.
Okay, I would like to respond really quick to the positions here. We have a legal and scientific process in place, and we have zero long-term studies at this point. And there's a reason these processes are in place. So my comment today is directed at unlawful actions by both state and local governments and deceptive measures in order to create a pandemic. The following is a summarization of fact, which includes all official sources to those facts, and I will make some corrections to some of those sources because I have more. Governor Newsom declared a state of emergency and is refusing to end it, which contradicts California state law, California Code 8627.5, which states that a temporary suspension of any statute, ordinance, regulation, or rule shall remain in effect until the order or regulation is rescinded by the governor. The governor proclaims the termination of the state of emergency, or for a period of 60 days, whichever occurs first. Number 2, according to the California Emergency Service Act, Section 8558-B, a state of emergency can only be called if the threat overwhelms the current resources of the state. Newsom declared a state of emergency in March 2020, yet hospitals around the state were laying off workers at the time. Currently, he is mandating vaccines, which chases healthcare workers out of the profession, thus creating a state of emergency. He continues to cling to the Emergency Powers Act and somehow believes that a state of emergency can be indefinite in duration in case we have future COVID outbreaks, which is contradictory to California Emergency Service Act. Also, Governor Newsom signed an executive order on June 18, 2021, while dropping mask mandates, enabling OSHA revisions to take effect without the normal 10-day legal review by the Office of Administration. Number 3, PCR tests have created many false positives, and I'd like to quote a source, which is the FDA. Since no quantified virus isolates of the 2019 nCoV were available for CDC use at the time the test was developed, and this study conducted assays designed for detection of the 2019 nCoV NRA were tested with characterized stocks of in vitro transcribed full-length NRA. Number 4, the CDC grouped pneumonia, influenza, and COVID deaths together, called the PIC deaths. And I'm going to send you a different link on this one. Number 5, federal law. The Biden DOJ came out with a legal opinion that the government can force vaccine mandates on federal government agencies. But this contradicts the direct wording of 21 U.S. Code created by Congress, the authorization for medical products for use in emergencies, which clearly states of the option to accept or refuse administration of the product, of the consequences, if any, of refusing administration of the product, and of the alternatives to the product that are available, and of their benefits and risks. And number 6, the definition of a COVID case means that anyone who tests positive on this
That is your time.
can then
Thank you very much.
Then those who actually.
We will now go to Thomas Becker to be followed by Amy Smith.
Hello, can you hear me?
We can.
Thank you. I first like to start off with a June 24th letter that was written by Dr. Ansborg, and the title of the letter that you can find on the public health site, quote, Delta variant not a risk for fully vaccinated people. Well, I think we can forgive the people in ICU that have been vaccinated to be a little suspicious of Dr. Ansborg and his medical decisions. Now, I've submitted a series of questions to the public health department, and I've received no answer back. Those questions are, part of those questions are on the agenda, the agenda for public comment. I've received no answers at all. And I kind of find it funny that you people want to find a way to get the vaccine hesitant people to get vaccinated. Well, you might want to answer their questions instead of stonewalling them. All right. Now, I'll give you an example of how some of your statistics may be actually incorrect and deceitful. You have a chart for daily case rates of vaccinated and unvaccinated persons. You're using the wrong denominator in that chart. Instead of using a denominator for the general public, it should use the denominator for the number of persons tested in the vaccinated and unvaccinated categories. I'll give you an example. On August 6th, you had 22 vaccinated cases and 72 unvaccinated cases. Well, how many people were tested on that day who were vaccinated? How many of the people who were tested that day were unvaccinated? What if you had 1,000 total tests and 750 of those tests were unvaccinated people? Then your results would be 3 times higher than vaccinated people. I don't know if that's the case. That's an example of how you're using or misleading people with a incorrect statistic. Now, I've asked the Public Health Department, I've asked my elected representative, Supervisor Hartman, to answer my questions. They're reasonable scientific questions. You've refused to do it. And you people should be ashamed. And I'll give you one more thing. If a parent took a child into a doctor and asked reasonable scientific and medical questions about the treatment the child is receiving, and that doctor refused to answer the questions, I think it would be reasonable for the parent to assume the doctor's a quack and probably take your child to another doctor. Thank you. I'm done.
Thank you, Mr. Becker.
We will now go to Amy Smith, and then we will return to Santa Maria for Sean Kaufman.
Ms. Smith?
Yes, I'm sorry that we lost the doctors. I guess they might find some of this uncomfortable, but I have been to such doctors who didn't like to ask questions or answer questions. And I have a PhD in material science, and I am very interested in analyzing data and looking at it critically. And I think that is what science is supposed to be about. And I have been treated very dismissively by doctors, and I feel I've been treated very dismissively by members of this Board of Supervisors and by this health department, because I also have had difficulty having questions answered. Dr. Ansorg did admit last November that there's a 16% false positivity rate for the PCR test in Santa Barbara County. I'm not sure how he gets that number and what evidence he has to back that claim, but other estimates put it as high as in the 90%. So this is why we need data about actual sick people and not cases. Cases can be very misleading because of the faulty PCR test that is being phased out according to the CDC. I'm very concerned about the letter that was written saying that by Dr. Ansorg that the vaccines are effective, but if you get the virus, if you spread the virus after you've been vaccinated, you are not responsible. So how could that be true if you know that the vaccine does not protect you from spreading the virus and you take it anyway and you are coerced to take it in order to go to school or order to go to work, then yes, you are responsible as anyone is, which it's not really your fault for transmitting a disease, but of course you try to prevent it. If you're sick, you stay home. But this is the kind of coercive behavior that makes people not trust the advice and feel like you're more of a drug rep and a marketing team than public health officials. And that's very, very concerning and upsetting. And, you know, there's a lot of talk about the heroes and the great hospital workers and how we had to slow the curve. That's why we all had to shut down all our businesses and stay home. And well, what about the ones who don't want to be an experimental subject for a gene therapy that's being labeled a vaccine? They are having a protest in front of Goleta Cottage Hospital on Saturday at noon. And I encourage every board member to go and talk to these people. You know, there is a diversity of opinion among medical professionals, like the ones who develop treatments that are much safer and lower risk than this vaccine to prevent and treat this disease. And we are not being given that information, and our providers are not telling us about that. Why is that? And the CDC is also trying to suppress that information. And that is shameful. That is actually, you know, I don't even want to say. So I really encourage you to come and listen. And I beg you to be responsible and objective in the data and address these questions and concerns that people have.
Thank you very much. That is your time.
And we will now return to Santa Maria for Sean Kaufman, to be followed by Kay Timms. Sean?
Good morning, Chair Hartman and Board of Supervisors. I'm a longtime resident of the Santa Maria Valley, and I've been a firefighter for Santa Barbara County for the last 25 years. Currently a fire engineer assigned to new development, planning and engineering. As you know, there's a lot of our workforce in the county are struggling with this very issue. And the fact that it's being mandated upon us with all the facts that we're seeing laid out in front of us, with vaccinated still transmitting and getting the virus, with kind of the appearance of the look down upon the vaccinated as the driving force for this. It's really not a good environment. You're seeing a mass exodus amongst your workforce, and that's not good. I'm going to requestfully ask if this is on record. Is this conversation?
This is being recorded. This is on record. Yes.
Okay. So my first question to you is, Chairman Hartman, Chair Hartman, is I'm asking you if the board unanimously votes for a mandated vaccine policy on its people. That's my question.
Let me explain. For public comment, we don't engage in a dialogue. We listen to the public, and then we may comment after public comment closes, or the doctors may also comment. So I'd encourage you to just.
Okay. I'll use the proper channels to get that answer.
Thank you.
Let's see. So now I'm going to talk a little bit about the policy that's coming out in regards to public health onto county employees that I know about, and possibly the greater workers at large, is a mandatory vaccine or weekly testing for the unvaccinated. Okay. So first of all, where's the logic in that when a fully vaccinated person can still transmit the disease and be a spreader? Okay. That looks to be, again, a discrimination against the unvaccinated and kind of singles them out. That's the appearance. Okay. Also, in regards to mandating an injection that the CDC says there's breakthrough cases, how can you mandate upon the people a vaccine that doesn't cure the disease so they can still spread it? I think you need to let the people make their own decision on that and let them do their own homework and decide what they want to put into their body. Moving on, in regards to the mask efficacy, Dr. Fauci has already stated that early on that masks don't work and we shouldn't be wearing them. And the size of the virus is smaller than anything required in your policy to the working people of the county. A bandana, these, anything other than an N95, by size of molecule that can go through everything that's on that list, with the exception of an N95 up to 95%. But in that policy, it doesn't say must wear N95.
And what is your time, Mr. Kautzman?
Okay. One last thing, I urge you to not vote for the mandatory vaccine. Thank you very much.
Thank you. And thank you for being here in person.
We will now go to Kate. We will stay in Santa Maria and go to Kay Timms, to be followed by Terry Strickland. Kay?
Hello, I'm coming really, I didn't really have a planned speech, but basically I'm representing a small business, a restaurant, my industry, and what my thoughts are coming. I'm alarmingly concerned at what I'm seeing many counties and cities adopting a policy going forward that would ask us to have people show us their cards or to police the immunization cards. We feel strongly, I feel strongly, many feel strongly that that's a bad position to put us in. We've already have struggled this last year, many of us financially. And when we were out front, people don't like us doing that. And I would appreciate, and I also think people think we are infringing upon them and their rights. And I personally would strongly suggest that when this comes into our county, you guys really consider the implications. And basically, I would go on record to say, if this is what our county is thinking about, then don't just stop at restaurants. You make them do it everywhere, because it seems like we're held hostage because we need to stay open. But what about all the other businesses and that they don't have to do it? So basically, that's what I'm coming here for, my record. Okay, thank you.
Thank you. And Ms. Strickland?
Yes, we will go to Terry Strickland next, to be followed by Andy Caldwell, who is our final speaker.
Chair Hartman and board, I haven't been before you for a while because the last couple times I've spoken, one of your supervisors have found it imperative to fact check what I say. And I find that very rude. And other commenters have felt the same thing. Even these ones that have spoken today have had Supervisor Hart kind of disparage their remarks and say we have all these smart doctors that are going to tell us, you know, what to think and what to believe. And no offense to the doctors. I know some of these doctors and they're very good doctors, but they're not the only doctors in the world. You know, I have a problem with people repeating misinformation. And just because you don't agree with what I say, that doesn't mean I have misinformation. According to the Centers for Disease Control and Prevention, the White House and most mainstream media, what we now have is a pandemic of the unvaccinated, with 95 to 99% of COVID-related hospitalizations and deaths being attributed to the unvaccinated. That's what they said. To achieve that statistic, the CDC included hospitalization and mortality data from January through June. The vast majority of US population was unvaccinated during that time frame. In other words, this statistic is unreliable, but people keep repeating it. There's a lot of science out there that isn't ever mentioned. Natural immunity offers robust protection against all variants, whereas vaccine-induced immunity can't. The reason for this is because when you recover from the natural infection, you have both antibodies and T cells against all parts of the virus, not just the spike protein. End quote. That was from Canadian bioimmunologist and vaccine researcher, Dr. Byram Bridle. There are thousands of doctors around the world that agree with this position and a lot of other positions. And I recommend you and anybody else who has not done it, read the Great Barrington Declaration. These are not conspiracy theorists. These are world-renowned doctors. The lockdowns that were supposed to take place for 15 days kept businesses shut down for months. 36% of California businesses will never open again. For the sake of our business community, their families and employees, and our local economy, I hope you will not just follow along with vaccine passports as they're doing in the big cities. There are thousands of medical professionals who believe this is unwarranted. Stop the fear. Stop the shaming, the bribing, the persuasion. If people want to get vaccinated, fine. If they don't, it's not anyone's business, especially the government's.
We will now go to Andy Caldwell, who is our final speaker. Andy?
Chair Hartman, members of the board, Andy Caldwell representing CoLab. For somebody with asthma, these masks suck. I'll just mention that. Anyway, I want to let you know, I've probably done 300 shows on COVID. I have doctors that are for vaccines, some that are not. I let the public health department come on the show to talk about when they had their new clinics and things like that. So I'm not anti-COVID, and I'm not even necessarily anti-vaccine. Even the frontline doctors who I've had on my show would recommend the vaccine, especially to older people with comorbidities. So I've not met anybody that's completely dead set against vaccines. But I have to echo what Terry Strickland and others have said, and this started at the very beginning. I used to be the industrial relations manager at Union Sugar. I developed our respirator program. I know that when the initial mask advice came out, they said you can make it from a t-shirt. I knew that was a bald-faced lie. I had industrial in relations experience safety manager factory with upward 300 people. It was a lie. You can't make a mask out of a t-shirt that protects you from a virus. And this has been our problem from day one. All the information that your board hears week after week has been one-sided. For instance, today, there was no mention of the fact that the younger the person is, they have a higher risk, even if it's a minuscule risk, they have a higher risk of heart problems if they get the vaccine. There is no mention of the fact of that the asymptomatics and or the people that already had the disease have antibodies. So when they say this is how many people have not been vaccinated, you never put in there the number of people that got sick from COVID and now have antibodies, and that the antibodies protect against the variant more than the vaccine. There are world-leading epidemiologists and virologists that believe the original COVID vaccine does not work against the variant because there's a different spike mechanism going on. But your staff never presents this data. We have Nobel Prize-winning virologists that believe it's the vaccine is driving the variant. Just like if every doctor, if there was a flu going around and every doctor prescribed antibiotics to everybody, whether they were sick or not, you would create a super bug. There's, like I said, Nobel Prize winning virologist believes that you guys have created and drove the variants. The big elephant in the room that you need to focus on, the vaccine does not prevent people from getting the variant or spreading it. And yet you want to mandate the vaccine anyway and treat the vaccine as different. There's so much more I could share. But again, we've been discounted. Even though we're not necessarily anti-vaccine, we're certainly not COVID deniers. Thank you.
Thank you, Mr. Caldwell.
And that was our final speaker on this.
So with that, I close public comment and it's back to the board. And are there some additional questions or comments that board members would like to make?
Madam Chair, I had a couple of questions that members of the public raised in public comment that I think it'd be great to have a response from the doctors we have. Mr. Kaufman asked the question about if fully vaccinated people can still transmit the disease. What is the purpose of the vaccines? So maybe, very simple answer to those questions. That question would be helpful. And then maybe just the other question that Mr. Kaufman asked was that, he's quoting something that Dr. Fauci said early last year about masks not working because the molecule is so small it gets through the cloth. So maybe, the medical professionals could address those specific questions directly.
Yes.
Go ahead, Dr. Ansarg.
Okay, thank you, Chair Hartman, to the board and Supervisor Hart. Yes, to the firefighter, first foremost, I want to thank you for your service. We rely on your services. And with regard to the vaccinated, as I mentioned in my little presentation, it appears that all of the COVID vaccines that we have available prevent infection of the Delta virus anywhere between 65 to 80%. Now, the Delta variant is very new, and obviously it can evade the immune system to some degree, but there's still significant protection from getting infected in the first place. And if you are unfortunate and get infected, you will clear the virus apparently much faster and will no longer be contagious after half the time of an unvaccinated person. So that's what I wanted to say with regard to vaccination. And I think Mrs. Strickland said the same thing, that if the vaccines don't prevent the Delta, they are useless. That is misinformation. And I would just encourage the public to understand that the vaccination is the best protection we have. And with regard to the masks, I'm guilty myself. I was interviewed in March of 2020. And on the record, I said there's no scientific evidence that masks actually prevent transmission of this virus. And so we're having inside jokes about COVID that, you know, in COVID time, one day is as long as a year in normal time because of the fluidity of the information that is coming out. We have an abundant amount of research now accumulated over the last 1.5 years with details about mask materials and the fitting of masks and what they protect and whom they protect and so forth. So I would really like to take this opportunity to debunk this, in my opinion, not helpful information or understanding that masks don't work. They do work. And that's pretty much all I want to say to this.
Thank you, Dr. Ansel. Supervisor Williams?
Well, I just want to give you the viewpoint of relatives that are in another country. Right now, my sister has COVID and is on a respirator, not because she was vaccine hesitant, but because they can't get enough of the more efficacious vaccines in most of the developing world. And I can tell you that the perspective of my family there is a lot different than this perspective. They scratch their head at why when in India and Africa people are dying large numbers, that relatively healthy people are unwilling to get vaccinated. And I totally understand if you had a severe reaction to your first vaccine, or if you have a health condition, I understand that. But at this point, there is sufficient danger of further mutations. There's sufficient danger just presented by the Delta variant. We should really question whether we are doing a responsible thing if people that are otherwise healthy and able to do so are unwilling to get vaccinated. And I'd say that the clearest one is just the local example. We had May and June, and it's probably even more of a difference now. 89% of the hospitalizations for COVID were unvaccinated. Only 11%, 6 individuals, were vaccinated. So, since at that time the proportion was relatively equal between unvaccinated and vaccinated in the public, that means getting vaccinated hasn't, at least in Santa Barbara County, reduces your chance of having to be hospitalized by 80%. To me, that seems pretty significant. And I hope that people will try to take themselves out of the sometimes politicized environment of their peers or the opposite party's expectations or their own party's expectations, and just try to make decisions and make responsible decisions for yourselves.
Thank you. Supervisor Nelson?
Thank you, Chair Hartman. I actually have a question for County Council that might be helpful for the public, because there's a lot of discussion on what the role of the board is on things like the mask mandate. Ms. Van Molen, would you explain to the public, how that works and whether the board votes on that, or if that's a decision that wholly comes from public health?
Supervisor Delson, members of the board, there is a separation here of authority between what the health officer can do and what the board regulates. And when we are talking about local health officer orders, or in this case, universal masking indoors under our local health officer order, that is in the jurisdiction of the health officer and not the Board of Supervisors.
Thank you, Ms. Van Molen. I think that that's a really important thing for the public to understand, because there is, we all get these different emails demanding our offices do things or make certain votes. And at this point, there hasn't been anything that's come directly from the board on a mask mandate or a universal vaccine requirement. And while some members of our board, if have the opportunity to vote on it, would probably support those types of policies, that's not something that's come from the board at this point. And the most recent mask mandate, and actually let me back up for a second and just say that I acknowledge that the vaccine is the best protection. And I want to make sure that I have that on record for people. I do believe right now that we probably have more COVID positive cases in our community than we may have in the entire pandemic. And I think that what you're seeing is that the vaccine is working at limiting the hospitalizations and the ICUs and the respirators, and things are changing, and I acknowledge that. That said, I am still concerned about the mask mandate. I don't think I personally disagree with the policy of public health here on this health executive officer order, but I also respect the discretion of Dr. Ansorg and Dr. Van Reynoso to make that decision. But I also want to get on record why I disagree with that. And it's not because I disagree that masks can't or won't work, but I believe that masks in the real world are problematic. I think one of the reasons why you're seeing the spread in certain families, especially low-income families, is because they may not have the same resources or the education on mask efficacy or mask cleanliness or mask hygiene. And these mask mandates force people to make sure they grab one on the way out the door, and it may not be as thoughtful in the process of wearing a mask. The other issue that I have with it is that it's a policy, and with the policy, there's consequences, there's unintended consequences to various policies. In a vacuum, it makes sense, but when you have a large population in our county that is still hesitant or still resistant to getting the vaccine, I think it sends the wrong message. I think that the benefit that's gained on a public health level by having a mask mandate doesn't weigh out for what it's done to people who may be on the fence on vaccines. I've heard from my constituents, I've heard from people in my community, and this again is the community that needs to be reached the most, that the mask mandate has actually made many of them decide that they don't want to go get a vaccine because they said, what's the point? We're going to have to do all this anyway. And so there's this constant drumbeat of regulations. And I know that our county is often bifurcated in their approach and the feelings politically. And whether we like it or not, masks have been politicized. And since they have been politicized, that's a constant that we know. It does a disservice to the people that we need to reach the most to have that mask mandate. The state hasn't required it. And I think we all understand that that's partly because there's a recall. So it feels, again, more politicized. We're the only county of our surrounding counties that have a mask mandate. Ventura only has a guideline and is seeing a similar trajectory of case rates. So it's not necessary, in my opinion, to do it. Again, I respect the doctors that we employ to make those decisions for themselves. But I also just want to caution the public as we're having these conversations, not to belittle people. Let people, I think what we need to do is respect people's decision for themselves. There's a risk assessment that we're all doing every day to figure out whether this is best for us. I do want to correct one of the speakers that said this is an experimental vaccine. It's not experimental, it's an emergency vaccine. And we are on our way to FDA approval. I do think the narrative changes once we have full FDA approval, but a lot of people aren't ready yet before the FDA approval happens. The reason why FDA approval is important to a lot of people because it's a process that we respect as a country, and we're on our way to that. And so I hope that we can all look at that and say, hey, give people some time. Let's continue not to overly push them with government regulations, because for a lot of people, especially independent people, that causes the opposite reaction for them. That gets them less likely to be vaccinated. Another comment that I heard about somebody that was recently thinking about getting vaccinated was they didn't want to get vaccinated because they felt like they were giving in. Okay, and the reason why they're feeling like giving in is because there's been a narrative and a drumbeat of people calling people that are unvaccinated ignorant, calling them conspiracy theorists, anti-vaxxers, anti-science. And I don't think that helps the conversation at all. I think what we need to be doing as a county is trusting people, respecting people's autonomy of their self, and then continue to educate them. I think ultimately that approach would have significantly better results in our county and in our country if we go down that route. So anyways, those are my thoughts. Thank you.
Thank you, Supervisor Nelson. And Supervisor Hart, I'm going to give you the closing, but I had a few things I wanted to say briefly. Before the break, we were all euphoric. It seemed like the vaccine was our ticket to freedom. And during the break, we learned that people who are vaccinated can be carriers of the vaccine, and it also can have breakthrough in infections with COVID. So now we have to change the message slightly. We need masks and vaccines. I dislike masks as much as the next person. My glasses fog up, my sinuses run, the bands can hurt. It interferes with my already faulty ability to identify faces. So they're not the easiest thing, but in the scheme of things, a mask is a very small matter if it reduces my chances of getting COVID and if it prevents me from infecting others by being a carrier. And even if I still have to wear a mask, I'm so glad that I'm vaccinated because it reduces the odds of me getting a serious disease or hospitalization, and it reduces the time I'd be contagious and probably the time I'd have to be quarantined. And that gives me a great deal of sense of freedom, much more so than a year ago. So we're all coming to terms with the Delta variant. And this virus is doing what viruses do. It's a real-time demonstration of evolution and adaptation. And so as the variants change, there's new circumstances. It's not that we're changing the goalposts. It's that we're adapting as the virus change. And that's how we can outcompete the virus. So now we have vaccines and masks. The biggest concern for most of us right now is we've got to get children back in school. We've lost so much learning over the past months and year that we know that's the highest priority. And so getting children who are eligible vaccinated is key. And then in classrooms, we're getting children to wear masks. There was a study done at Duke that was reported in the New York Times where they had 1 million children and they looked at those in environments where they were wearing masks and where they weren't. And what they found is that in school situations where they're wearing masks, they didn't have the breakouts. But once you have a big breakout, then you can get quarantines and then you have to shut down and then we're back into this cycle. So I submit that we have learned to do things. We've learned to use our seatbelt. We get vaccinated for other kinds of diseases. So mask plus vaccine is a very small price to pay to keep our children in school. Supervisor Hart.
Thank you, Chair Harmon. That was really well said. I appreciate every bit of that. We started our meeting today honoring people who are working on the front lines, protecting community health and helping with food insecurity. And I think that message of togetherness is really, really important. And it should guide everything that we do in our communications to the public, recognizing that we are all in this together. And in that spirit, I really want to thank Dr. Dorenoso and Dr. Ansorg, Dr. Fitzgibbons, and Dr. Merrill for being here today to answer questions. We obviously, in a limited format, don't have an opportunity to answer every question that folks from the public posed, but I think that is something we need to work really hard to do. There is a consistent, persistent narrative that questions aren't being answered. And so we need to do that. We need to put something on the public health website that is in a Q&A format that is regularly updated with the most recent questions that people are having. We had a bunch today. So I would urge
the public health communications folks to take that challenge on and to regularly update that. And, you know, if we have to go back in time and address issues that we thought were resolved and agreed upon, you know, that's what's necessary to bring people along, because it's becoming more and more clear every day that we're going to have to learn to live with COVID. You know, I think all of us hoped there was a point when we'd be on the other side of this. And it isn't necessarily clear that that is the case now. And so we are going to all have to work together and use all the tools in the toolbox, you know, vaccinations, encouraging people to make that choice, indoor mask orders, other orders like that, improved ventilation in buildings, you know, whatever tools we need to employ to make this something that we can continue to live our lives and have the quality of social and human interactions that we all desire and want, at the same time protecting each other from a really serious disease. So with that, I appreciate this update and think this is really valuable to the public to hear directly from the people who are helping protect us.
Dr. Dorianoso, let me ask, would Supervisor Hart's suggestion of a frequently asked questions section in the website at Public Health, would that be something you could do?
Chair Hartman, yes, we do currently have an FAQ on our website, but certainly I took notes about the questions that have come up during this, and we will add to those questions. With regards, we do get quite a bit of emails requesting very detailed, researched questions. And so we do spend time on them, but unfortunately, given all the other priorities, we have not been able to go through those questions as speedily as we would have wished. But one of the public speakers mentioned that that is something that we are currently working on, researching the answers to his questions.
Okay, well, thank you very much. So may I have a motion, recommended actions A through C today on our board agenda, board letter?
I'll make that motion.
Second.
And Madam Clerk.
And Chair Hartman, members of the board, I would like to note for the record, Supervisor Lavanino did have to step away momentarily, but will be joining us shortly. Supervisor Hart?
Aye.
Supervisor Nelson?
Aye.
Supervisor Williams?
Aye.
And Chair Hartman?
Aye.
Motion passes unanimously.
And my preference is that we just continue to item 2. Would my colleagues be amenable to that? All right, let's go. Madam Clerk, would you read item 2 into the record?
Chair Hartman and members of the board, departmental item number 2 is from the County Executive Office, Auditor, Controller, General Services, and Human Resources. It is a hearing to consider recommendations regarding a business application needs assessment project update and request for proposal RFP for County Enterprise Resource Planning, ERP, software and implementation services. And before we go to staff's presentation, I would like to note for the record for members of the public who are participating in our meeting today of updated timing for our board agenda items. We will take up this item and then recess to closed session, and that will be about until 2 o'clock. And then we will take up departmental item number 3 from Community Services from 2 to 2:30, and with an estimate for departmental item number 4, which I know many members of the public are interested in today, for the countywide community workforce agreement. Best guess estimate at this time is around 2:30. Thank you.
Mr. Preplow?
Thank you, Chair Hartman and members of the board. Good morning. It's great to be here with you today. Today really marks a milestone in the county's journey to evaluate the next generation of technology that's needed to support county operations throughout every county department in order to help us be effective, help us be efficient at what we're doing, and really move into a more data-driven decision-making ability. So we're at that transition point. You grab our first slide. And today really marks that point where we're moving from what we've referred to as BANA. Actually, go back one. BANA, which was a business application needs assessment, which the county has done over the last year and a half, to moving toward the ERP, Enterprise Resource Planning System. So today, we're going to be presenting to you just an update of what we've been through, how we got to where we are today, with respect to how we move forward with the issuance of an RFP, subject to your board's approval today, for moving to the next step. I'm joined today by Kyle Slattery. Kyle is the Chief Deputy Controller in the Audit Controller's Office, and he is graciously, I don't know about voluntold or volunteered, to serve as the county's project manager. So throughout this next 2-year plus journey, as we move forward, you'll see Kyle a lot at these presentations, keeping your board apprised of the progress we're making in this important endeavor. I want to take a moment really to highlight kind of the participants that have helped us get to the point we are. On the left side of the screen, you'll see the members of our project steering committee. I want to commend them for their dedication and time devoted to making sure that the process that we've employed so far prepares the county in the best way possible for ultimate success in the project. The BANA project was led largely by the Audit Controller's Office, and a special shout out to Betsy Schaefer, our Audit Controller, and her team for helping shepherd the county through this process. The process has been very inclusive, as you'll hear in a moment, as Kyle presents, in that every department was represented as part of this process. We had more than 90 or nearly 90 folks from all departments participate in making sure that as we set the stage for moving to the next series of technology, that we are addressing all the operational needs of those departments. So special shout out to these folks that are on our steering committee, Betsy Schaefer specifically for spearheading the BANA process as we move into the ERP process. So Kyle, as I mentioned, is going to serve as the county's project manager, and I couldn't be more pleased about that. He is supported by Alex in his office. And we're also supported very ably by our consultants, which we retained from Guidehouse. I think on Zoom today, we're joined with Art. Each of the project steering committee members are available either in person today or on Zoom, I believe. So with that, at the conclusion, let me tell you what the conclusion is. That the conclusion, as outlined in your board letter and here on the screen, is that you receive and file our business application needs assessment project update, authorize the release of the RFP, and make the adequate CEQA finding, the appropriate CEQA finding. So with that, let me turn to Kyle.
Okay, thank you, Jeff, for that warm introduction. And thank you, Chair Hartman, as well as members of the board for receiving this presentation and project update today. I am Kyle Slattery, Chief Deputy Controller in the County Audit Controller's Office and the project manager for this BANA project, as well as the eventual ERP implementation effort. So this is an overview of the material we have planned today. First, we're going to talk about phase 0, our planning and preparation for the current phase, the BANA phase that we're in now. Then I'll provide a really brief overview of the vendor evaluation and selection process, spend a couple minutes just talking about overall project success, touch on project structure and governance. Then I'll turn it back over to Jeff to discuss the fiscal impacts before we get into the recommended actions and next steps. So here's an overview of phase 0. This was really setting the stage for the work to come. This was the planning, the preparation, and the beginning of change management here at the county for the eventual impact of this project. We began it in 2019, and it aligned very well with our fiscal year 1920. And that's what we're calling year 1 of the project, or phase 0. In the summer of that year, we formed our countywide stakeholder team. This started with various CFOs and IT managers from all county departments. We had 39 individuals in the beginning, and as Jeff mentioned, we have over 90 participating in the project now today. In the fall, we developed the RFP for the assessment consultant. It was a very collaborative process where we had subcommittees of the stakeholder team actually draft elements of the RFP, review and approve that material, and ultimately had a handful of individuals participate in the evaluation committee, which led to the selection of Guidehouse. So we performed those evaluation and selection committees in the winter. And then eventually in the spring, we finalized our contract for the assessment consultant, which resulted in the selection of Guidehouse. What we were looking for in a consultant was a good partner for the county that was collaborative and could really guide us with superior technical expertise into the future. And after a year of working with Guidehouse, I can certainly say they've provided that expertise as well as that good partnership. We've been very pleased. So the last touch point we had with your board was in July of last year when we received approval of that contract with Guidehouse, which commenced the business application needs assessment project. So getting into that project, it's helpful to look at it from a scope of services perspective. It's divided into 4 tasks. Task 1 was the needs assessment itself, analyzing the business applications here at the county and determining how they meet our needs and where there are gaps in functionality, features, or needs from our various departments. Task 2 was then taking that information and developing a plan of action to implement solutions. What do we do to get the county where it needs to be? Then that led to task 3, which we are currently commencing right now in front of your board to request authorization to release the RFP so that we can receive proposals from qualified software solution companies as well as professional implementers to implement an ERP system here at Santa Barbara County. Then eventually that process will lead to task 4, which is the contract negotiations. So I do want to spend a bit of time digging a little bit deeper into task 1 and 2, which, as I said, have been completed as of now. Guidehouse, with the help of our county project team and the involvement of our very broad countywide stakeholder team, performed a comprehensive assessment of 134 county business applications. This included 34 interviews across all of our county departments with CFOs, IT managers, as well as various subject matter experts. We mapped 16 countywide business processes, as well as 8 interface diagrams, which show how our systems connect, and in some cases where they do not connect. We facilitated 9 future state sessions to think about what would be the ideal state for our current infrastructure of technology here at the county. And then it researched 25 best practices to begin to benchmark where we want to be. So a few key highlights here. Task 1 basically told us that there was 8 indicators that the county really does need to be looking to replace its system infrastructure in order to provide a technological platform to advance into the future. Another thing was that there was, plenty of opportunities to improve the current state of our business processes. This is not just a technology or software project. It really is a business process project, how we do things here at the county to support our operations and provide services to the public. So there was also over 100 recommendations, consisting of recommendations to prepare for a new solution and to improve our future state business processing. And ultimately, task 2 resulted in a comprehensive plan of action to acquire, implement, support, and govern a new solution throughout its useful life. So these are the 8 indicators that signal the county must undertake this initiative now. I want to touch on a few. The first one on the top left, that there are no new versions of custom applications available. By no fault of our own, we developed a lot of applications here in-house at the county because there was not a robust marketplace for the software that met our needs. That was, 20, 30 years ago. Now there's a very robust marketplace for business applications that meet the needs of county governments. So we're able to leverage what's available in the marketplace and no longer need to hire programmers to develop systems, do a lot of coding, and provide the maintenance and support of in-house custom developed applications. That really does allow us as a county to focus on our core competency, which is providing services to the public, not necessarily programming and developing our own in-house applications. A couple other things there, the emergence of secure cloud computing really does provide a great opportunity. We will no longer need to have a bunch of servers on site storing our data. This also is a platform where the software companies release updates periodically, usually quarterly or even annually, that really give us the latest and greatest features in both security as well as features and functionality. So allow us to leverage what's available to always have the latest and greatest and best solutions that we can for the county to perform efficiently and effectively. And one of the key things that I do want to emphasize is really just meeting the expectations of the workforce. Many of us have smartphones and we're used to really robust functionality in the software and applications that we use in our personal lives. And there really is now an expectation that there'll be similar features and functions in the workplace. And when you go from something really robust and then you go to work and it kind of seems outdated, it does impact the mentality of the workforce. So it's an opportunity as well as to just meet the expectation of our county workers. So here's the scope of a county ERP system. In the heart there, you'll see that it's budget, finance, and human resources and payroll. And then all the boxes around are all of the work streams that our county workforce performs in order to support our business operations. So I won't go into much detail on this. The key takeaway is that it's very robust, very comprehensive, and it touches a lot of the things that we do here at the county to support our operations. One of the other key things coming out of task one was this list of recommendations to prepare for an ERP project. These are significant projects. They are very complex. And so the more ready we can be to execute a successful project, the better positioned we are to achieve that success. So Guidehouse provided these 9 recommendations categorized into 3 categories to really help us get ready to have a successful project. This is our to-do list, and these are the type of activities that we'll start tackling this fall as we prepare for the eventual ERP project. So this is the plan of action, task 2, which said this is what we need to do in order to acquire a new solution here at the county. We're currently on the left at the acquisition phase. So this is happening right now through March of next year, where we will be issuing the RFP, receiving responses from qualified vendors, evaluating them in a very fair and transparent way, and ultimately making a selection of which solution provides the best value and meets the needs of the county. In parallel with that, in this fall, we'll start our readiness period, getting ready for that new solution and tackling those 9 recommendations on how to prepare for implementation. Then we have the implementation phase, which is about 2 years in duration, broken up into various phases based on the modules of an ERP system that we will be implementing. And then post-implementation, July 2024 and beyond. It's not uncommon for some of these systems to last 20 years plus. So this is really a big impact to the county now as well as in the future. And we do want to highlight there that the change management side is very critical. Implementing a new software solution is going to change the way we do things here at the county. And that's not something we can sell on people or force on people. It's really something that people need to understand why and how it's going to benefit the county system as a whole. So developing a formal change management plan and implementing that plan is of utmost importance. So here's what we have ahead to complete the Banner project, which would be tasks 3 and 4. We're in this summer of 2021. We're about to issue the RFP for the ERP system as well as an implementer. We'll then complete task 3 this fall, which is evaluating and selecting a finalist. In the upcoming winter, we'll commence and complete our contract negotiations, and then we anticipate returning to your board in the very early spring or late winter with to request approval of the ERP contracts. Now, in parallel there, this fall, we're also going to start those readiness activities, as I mentioned. Knowing that this ERP solution is coming down the line, we want to get the house ready now to have an effective and successful implementation project. So we anticipate returning in October with a staffing plan, really with some initial details on what we're going to need from the county workforce in order to execute a successful project, and what we might need in terms of external consultant help where necessary in order to ensure that we are a case study in how to do one of these projects right. So here's a quick overview of the vendor evaluation and selection process. Basically, we're going to take all the proposals, evaluate them in a very robust, transparent, and fair way, which will result in a vendor shortlist. So that will be a 9-member evaluation committee of CFOs, IT managers, HR experts, as well as operational management, evaluating those proposals to make that shortlist. Once we get the shortlist, we're going to invite those vendors to provide demonstrations of their software to a broader group of the evaluation committee, plus various subject matter experts from throughout the county and all of the various departments. Part of that demonstration is also interviewing the implementer. Who will we be working with to actually implement this software that we acquire? So that will eventually result in the identification of a finalist and a vendor selected for the ERP software, as well as the implementation services. Here's a quick snapshot of ERP project success. We are aware that these projects have risks, and some of them fail to deliver results or could go over budget or otherwise compromised. So we are very laser focused on a success mindset, identifying the risks, being aware of them, and then implementing effective strategies to ensure that we execute a successful project. So the risks are on the left. Those are just 7 of them. Those are not all, but there's some that we thought, kind of percolated up to the top. And then on the right, we have some of our various mitigation strategies, which collectively we're employing to execute a successful project. The one at the bottom there, just this mindset of win early and win often is really important to me. These are long projects and we need to start showing results early. We don't want to get 2 years into it, have nothing to show for it, and spend a lot of money. It's really important that everyone involved understands that we need to win early, we need to win often, and we need to gain that momentum in order to ensure that we have a successful project. Finally, this is just a quick project structure and governance chart. What it shows here is that underneath your board is the Executive Information Technology Committee. Under that, EITC is the steering committee, which Jeff mentioned in the introductory slides. And underneath that steering committee is our county project team. We're working in partnership with Guidehouse there. And really the foundation for all of this is that countywide stakeholder team, those 90+ individuals that are the ones that are going to be experiencing the change and really carrying out the results of the project. So just the key takeaway here is that our strategic direction flows from the top and our key recommendations flow up from the bottom. Next, I'll turn it back over to Jeff for fiscal impacts.
Thank you, Kyle. I do want to just kind of take a moment to reiterate something Kyle said, because I think it's really important for the whole stakeholder team and for the county to focus on. The implementation of an ERP is really kind of a once in a professional lifetime event. It's not something that we do often. It's a big investment. It's critical to our operational functionality. And so this is not, as Kyle mentioned, it's not just replacement of a technology platform. It really is an opportunity for us to look seriously about the processes that we do now. Many of them put in place decades ago. Are they the right processes today? They were when they were implemented, I'm confident. They're implemented by very intelligent people who knew the needs of the time. But this is really an opportunity to step back, look at the way we function, and say, what would we like to do? How do we respond to the changes over the last years? How do we respond? How are we more responsive going forward? And how do we maintain our resiliency to move forward and be relevant? And so that's really kind of the underlying theme as well. And this is opportunity to take. So I want to, Kyle mentioned that in the slides, but I think it's worth repeating. We have been before your board a number of times talking about this. And so this isn't a new subject for you today, but in the current fiscal year, the BANA consultant is continuing to work with us through the RFP process. We appreciate their work. In the budget development policies in November or in December that we brought to your board, we talked about the financial implications and the need for the financial investment, as it really is an investment the county will be making in this transition. In the workshops, we had a special issue talking about this BANA to ERP transition as well. As we look forward into the upcoming fiscal years, you'll continue to hear more about this as we marry the process, marry the system implementation with all of our budget narrative in an even stronger way. We did note in our early presentation to your board that it probably has a likely price tag of $10+ million. So again, not a small investment, but critical nonetheless. We will be going through, obviously, as Kyle mentioned, the RFP evaluation. Once we get the proposals back, we'll have a much better feel for you and be able to share with you what the budgetary impacts are in a much more robust way. As Kyle mentioned, in October, we hope to return to your board to augment some select staffing in departments, understanding that when you're doing an implementation of ERP, the folks that you want helping us implement are our current subject matter experts. And to take them out of their role they currently have and dedicate them to this important endeavor means there's a void left behind them. And so we'll be talking to your board in October what that looks like. We've set money aside in the budget in the current year to address that. We haven't appropriated. So when we come back to your board, probably in October, we'll be asking your board for some FTE and appropriate the money that we've set aside for that purpose. So that'll be a future conversation with your board. And then the project management consultant, as Kyle mentioned, will be for the next phase. So we have Guidehouse in the current phase has been critical in helping us guide us through this process. We'll be looking for a consultant then to help us through the implementation as well. So that will come back to your board in October. So just as a recap, we would ask that your board receive and file our update today to authorize the release of the RFP and to make our CEQA finding. Subject to your board's approval, our next steps would be to actually release the RFP. We expect to do that on Friday, subject to your board's approval today, and then return back to your board in October, as I mentioned, incorporate all this discussion in our 5-year forecast, which we'll bring back to your board in November. And then in early 2022, recommend the RFP software and implementer contracts. So with that, we'd be happy to answer any questions. As I mentioned, I believe our entire steering committee is available either in person today or on Zoom, as is our Guidehouse representative, Art.
Thank you. That was a tremendous presentation. Really appreciate it. Supervisor Hart, you're first.
Yeah, I want to thank Mr. Propwell and Mr. Slattery for a great presentation. That was clear, to the point. You made us aware of the consequences. This is a big investment, both in money and in the operational effectiveness over a long period of time. So your eyes are wide open. Ours are now too. And just really appreciate that you've been really thoughtful in preparing this effort, identifying the risks, having strategies to mitigate those, and really including a lot of people. In addition to the steering committee, which are really important leaders in the county, you've got 90 people, who are doing the work directly that are involved in this process. And I think that's really going to help pay good dividends as we go through this process. So I'm just really impressed and want to say thank you for doing a great job.
Supervisor Nelson.
Yeah, thank you, Chair Hartman. My question is more about the financing of the $10 million price tag. So is this general fund dollars, or are we able to charge that against various departments? It seems like it's something that's going to help the county as a whole, not just general fund departments. Are we able to spread those costs throughout the organization?
Supervisor Nelson through the chair. So good question. The price tag is will likely be initially funded by the general fund and recouped through the cost allocation plan process, which then allocates those costs to all departments and all funds. So it is ultimately shared across all funds, which includes drawing down federal and state dollars where available.
So I guess my follow-up to that question is, so if it's initially funded by the general fund and then it's recouped by the various departments, is then refunded back to the general fund in the future?
Supervisor Nelson through the chair. So the process is the charges out to departments that pay what we refer to as the CAP, the cost allocation plan charges. It comes back to the general fund not in a departmental budget, but rather in 991. 991 is our budget that we track and receive most general fund revenues that are discretionary. And so the reimbursement back to the general fund comes into that. That is one of our key funding sources then for subsequent budgets, if that makes sense.
Okay, I think it does. Thank you.
And is that all your questions, Supervisor Nelson?
It is. Thank you.
Supervisor Williams, anything?
No, I just think judging from the history of these two employees, these are the right people to be in charge of the project. Appreciate and have confidence in your work.
And I just wanted to add, this is a hugely ambitious project. I think of slide 9. I mean, it's really, and I've been in two organizations where they really botched it, and it was a lot of money down the drain, and it was hugely embarrassing to everyone. But I look at the risks that you have and how these are being managed and the very careful way this is being sequenced and early on reaching into the county workforce. And, it's hard to teach people and get people to want to learn new things, even if it's easier. And I'm the best example of it with my iPhone and all the apps. So getting people excited about this early and understanding that their commitment is key, I really applaud you for that. And like my colleagues on the board, I think we've got the right people for one of the most complex things we'll do as a county. It's not glamorous, but it's the foundation that enables us to work efficiently and across departments and coherently. So I really appreciate that. And with that, may I have a motion?
I'll move the staff recommendation.
Second.
Madam Clerk.
Supervisor Hart.
Aye.
Supervisor Nelson.
Aye.
Supervisor Williams.
Aye.
And Chair Hartman.
Aye.
Motion passes unanimously.
You know what? Did I ask for public comment?
Chair Hartman and members of the board, good catch. My apologies. I would like to note for the record, we had no request to speak on.
Thank you very much.
Thank you.
And with that, we're about to recess to closed session. And Ms. Van Mullum, will you tell us what we're going to talk about in closed session?
Thank you, Madam Chair, members of the board. We have 2 items scheduled for closed session today. The first is significant exposure to civil litigation under Government Code Section 54956.9. That's one case. And there's a description in the agenda of that item. And then the second is a conference with real property negotiators, Government Code 54956.8. It involves assessor's parcel number 005-080-006 on Temple Street in Summerlin, California. And the time estimate is about an hour.
So we will return about 1:30. All right. Thank you very much. We're recessed until 1:30. Good afternoon. We're reconvening the August 17th Santa Barbara County Board of Supervisors meeting here in the Santa Maria hearing room and coming back from closed session. And County Council, would you report out from closed session, please?
Thank you, Madam Chair. The board met in closed session on 2 items, significant exposure to litigation, 1 case, and real property negotiations for APN 005-080-006 Temple Street in Summerlin, and took no reportable action.
Thank you. And turning to departmental item number 3 on our agenda today, Madam Clerk, would you read that into the record, please?
Chair Hartman and members of the board, departmental item number 3 is from Community Services. It is a hearing to consider recommendations regarding approval of the first fiscal year 2021 through 2022 action plan substantial amendment, execution of community development block grant CDBG subrecipient agreements to implement projects approved by the Board of Supervisors on April 20th, 2021, and as proposed in the first 2021 through 2022 action plan substantial amendment and execution of human services grant HSG agreements with Good Samaritan Shelter and the Central Coast Commission for Senior Citizens.
Thank you. And turning to then Community Services, is Mr. Chapchin here today?
I am. I'm zooming in. Good afternoon, Chair Hartman and members of the board. As the clerk said, we're here today to receive approval to execute CDBG and Human Service Commission contracts for grant awards that were approved by the board in April, and for a few others that were not earlier approved. I'll turn this over to our Deputy Director for Housing and Community Services, Dinah Lockhart, for further details and explanation.
Good afternoon, Chair Hartman and supervisors. The board approved the county's 2021 action plan on April 20th, which contained the approved community development block grant awards to public service programs and to execute contracts. A few changes have transpired since April that require additional board action. Slide 3. I think we need this switch. Oh, okay. $17,911 in CDBG funds needs to be reallocated due to Communify discontinuing its administration of the senior nutrition program, and 2, a recalculation by HUD of CDBG allocations for 2021 that increased the county's CDBG allocation by $2,911. The Human Services Commission's Allocations Committee met on July 1st to make recommendations for these funding reallocations. Slide 4. The Commission recommends that $4,251 be awarded to Meals on Wheels of Santa Maria Valley to provide a total of $20,000 in funding, which was the amount requested in the agency's original application, and $13,660 be awarded to the Santa Ynez Valley Senior Citizens Foundation's Meals on Wheels program, which was not previously awarded funds in this past fiscal year. Slide 5. In addition, there are changes to the awards to programs under the Human Services General Fund program. These actions are not a part of the action plan, as they are not federal funds, but need board action. $30,000 in county human services funds was awarded to Communify for its senior nutrition program, which was discontinued on July 1st. And $30,000 was awarded to the Unitarian Society to operate the Freedom Warming Centers. The Unitarian Society has decided not to continue as the fiscal agent for the Freedom Warming Center program. The Unitarian Society is working cooperatively with Good Samaritan Shelter for Good Sam to take over the operation of the Freedom Warming Center program. Slide 6. The Human Services Commission recommends that $30,000 previously awarded to Communify be awarded to the Central Coast Commission for Senior Citizens, which is the area agency on aging, which will offer a senior meal program, and that $30,000 previously awarded to the Unitarian Society be awarded to Good Samaritan Shelter to continue the Freedom Warming Center programs. Slide 7. The CDBG program requires that when changes are made to previously approved programs or additional programs are added, that an action plan amendment be submitted to HUD. A 30-day public comment period commenced on July 16th and concludes at the end of the public hearing on this item. No public comments have been received by County HCD as of today. Slide 8. And we are available to answer any questions. This ends my presentation.
Thank you, Ms. Lockhart. Supervisor Williams.
Hi, Donna. How are you doing?
Hi, good afternoon.
Thank you for these efforts. I think this is there have obviously been some longstanding issues with meal programs. And hopefully this will begin to help them, because there are some people that really depend on them. The one thing that I was a little alarmed at when I looked deeper into this was the per meal cost that was going into this. So can you articulate what the per meal cost of these new reallocations will be?
Chair Hartman, Supervisor Williams, no, I would not have those numbers here today, this afternoon. However, we can certainly get them to you.
Yeah, well, maybe you could tell me then, is it volunteers or paid drivers with these providers? Because that seemed to make a huge difference. I think Communify is an amazing organization, but when we looked at the cost per meal, it looked like it was almost $15 a meal, right? You know, and that level of cost is really alarming, right? I hope we will look at that, and if you could provide that information to me, that would be.
Certainly, we can look into that.
And Supervisor Lavanino or Supervisor Nelson, did you have any questions?
Nothing for me.
Madam Chair, this is something, I think the issue's bigger than just this one item, though, that, I think I've been concerned about this for a long time, and it's the whole senior nutrition overall program. I mean, just speaking about what we're doing today, I'm fine with it. And when Supervisor Williams was talking about the cost per meal, some of these organizations are built on, hopefully there's going to be a donation at the end when they deliver the meal. It's just not a great business model. So, I've always asked for more of a, what I found is a lot of organizations like to be involved in the senior meal program because it actually is a good way to fundraise. Who doesn't want to contribute to Meals on Wheels in some way? But to me, it seemed like we could have a much more streamlined process. But that's for discussion for another day. I'm very supportive of what we're doing today. But just in the back of your mind, I think we can do a better job delivering these meals.
And Ms. Lockhart, is that somewhere on the horizon where we'll have a fuller look at senior nutrition, or CEO Miyasato?
Supervisors, to the chair, we've had internal discussions. As you remember, the board had appropriated funds for Department of Social Services when we first heard about the potential of having a need. And we can ask Mr. Nielsen what work he's done to date. I know it's, I think what Supervisor Lavanino is saying is repeated by many. It's a Herculean effort to try to figure out what's the best system, given there's so many different organizations providing it. But we can ask Mr. Nielsen to provide an update, if not information to the board, then maybe some presentation as we head into the spring.
Good, thank
Madam
you.
Chair, in response to that, I would just say that I agree with CEO Miyasato, and I guess my major concern is as long as there's seniors that are getting their meals and we're not leaving some, it's not a financial, it's not a huge financial burden on us. So if this is working, I'm fine with that. I just want to make sure it is working.
Okay, point noted. So, Madam Clerk, do we have any public comments on this item?
Chair Hartman and members of the board, we have no request to speak from the public on this item.
Thank you. Then may I have a motion for staff recommendation A through D?
I'll move it with the additional directive to analyze this always with a per meal cost in future presentations.
All right.
I'll second that motion.
All right. And Madam Clerk, will you call the roll?
Supervisor Hart,
Aye.
Supervisor Lavanino,
Aye.
Supervisor Nelson,
Aye.
Supervisor Williams,
Aye.
and Chair Hartman.
Aye.
Motion passes unanimously.
Okay, turning to item number 4 on our agenda today. Madam Clerk, will you read that into the record, please?
Chair Hartman and members of the board, departmental item number 4 is from the County Executive Office and Public Works. It is a hearing to consider recommendations regarding the development of a countywide community workforce agreement, CWA, ordinance, and project template. And if you are a member of the public and would like to speak on public comment on this item and have registered via Zoom, now is the time to log in and provide your comments. Thank you.
And how many public comments do we have, Madam Clerk?
Chair Hartman and members of the board, we are at 31 requests to speak on this item.
Okay, so we will close public comment at 31. And because we do have so many, we will limit them to 2 minutes each. And with that, we'll start with the presentation from Mr. Golphin.
Yes, good afternoon, Madam Chair and board members. Public Works is before your board today at the request of the CEO to present the development of a community workforce agreement, also known as a CWA ordinance, and project templates. Myself and my team who are here today, we have Johanna Hartley from County Council, I believe is on Zoom, and Chris Stedden, Deputy Director of Transportation and Public Works. We were the county's negotiators when this was done in 2014. And depending upon your board's direction today, the same team will be involved in producing a CWA this time with the inclusion of Patrick Zarowski from General Services as well. So, there we go. So Madam Chair, at this point, with your permission, we're ready to commence the presentation.
Please.
So why are we here today? In April 2019, your board directed staff to draft an ordinance governing the use of a CWA on public projects. In addition, your staff provided direction to General Services and Public Works to negotiate a template of terms to be used in the framework of future project-specific CWAs with the Tri-County Buildings and Trades Council. So today, what we're going to bring forward is 2 draft templates for your board's consideration. I say draft because your board hasn't considered them before, with the exception of the 2014 conceptual PSA. That's the first template we'll discuss today. And then the second one is the City of Santa Barbara's CWA, which was approved in July of this year. So where will we go in this presentation? We'll talk about what a CWA is. We'll go over the 2014 board conceptually approved project stabilization agreement or PSA. We'll discuss the process and the 7 negotiating points at that time. We'll touch on balancing concerns. We'll touch on the City of Santa Barbara process. They had essentially 4 negotiation points that they needed to resolve before that was finalized. We'll have some decision points here for your board. You'll have 5 different options to consider today. And depending on which option is chosen today, staff will need your input on options 2, 4, and 5 if we are going to start conducting some negotiations with the Tri-County Buildings and Trades Council. And then we'll close on coordination and process. There's 3 items in there we need to talk about, and there's 2 that we would need some direction from your board on today as well. So what is a CWA? In the construction community, a CWA is a contractually binding negotiated agreement between a project owner, that would be the County of Santa Barbara if we do a CWA, and the building and construction trades. CWAs require that all contractors working on a project adhere to a collective bargaining agreement, and there are no guarantees that a CWA will increase or decrease construction costs, nor attract or detract local labor. beyond good faith efforts that we can write into the contract. Also on public projects, all applicable state and federal bidding statutes and regulations must be followed. What we've noticed is CWA seem to be used in the construction industry to set terms and conditions of employment on large projects of long duration and design complexity. Really expensive projects. That's why you see a lot of agencies setting high thresholds, projects that include multiple crafts, if you will, from the building trades, and multi-year type projects. CWAs allow for the expeditious resolution of disputes that can arise in the course of a project, which would be helpful if it's long duration. May include provisions that seek to improve conditions on the work site in the areas of safety and quality standards, provides benefits to the community by including jobs and training opportunities for disadvantaged workers in the community. I should note that the County of Santa Barbara has never used the CWA, a PSA, or a PLA. So the facts I'm mentioning today come from the construction industry, not our experience to date. So supporters of the CWAs tend to say that a CWA may assure such things as a steady supply of skilled labor, commensurate benefits, and work rules across multiple crafts. CWAs allow for timely resolution of labor disputes. Community benefits may also include high-paying jobs and training opportunities, as we mentioned, for disadvantaged local workers. They often contain language defining health and safety provisions, safety practices and minimum security requirements. That was one of the issues that was attractive to us in 2014 when you're building a jail. We wanted to ensure that we had some minimum security requirements associated with that project. And they allow non-union contractors to bring core workers with them. This one's an interesting one because it's really in both categories, because the union contractors see this as a potential benefit, but the non-union contractors see it as a disadvantage. Opponents of the CWAs say that it places additional burdens on non-union contractors, particularly small local contractors with bidding on projects. It may reduce the number of bids on a project, limiting competition and raising overall project costs. And it may be redundant as the project will be constructed in accordance with state and federal statutes. And the low bidding contractor must abide by appropriate prevailing wage laws and fringe benefit requirements. So let's spend a moment now reviewing how we came to the conceptual board approval of the county's 2014 PSA. And really, this is the first template today and one of the options for you to consider later on. At the time, the board directed staff to negotiate with TCBT and stakeholders within certain parameters to establish the PSA. County's goal at the time was to negotiate a balanced PSA that would maximize potential number of bidders and local participation. So there was three goals there: trying to find a PSA that didn't favor one side or the other, the union contractors or the non-union contractors. We always want to maximize the number of potential bidders because we get the best possible bids, and we wanted to maximize local participation. We spent about 10 weeks together, and staff returned to the board in the fall of that year with the proposed conceptual PSA, which was the outcome of that negotiation. Unfortunately, TCBT failed to receive 100% approval from their trades and affiliates, and that's where the process essentially stopped. So the 10 weeks of negotiations focused on these 7 negotiation points. And, you know, in our research, when we look at the industry and the negotiations that go on with CWA, it usually falls into somewhere between 4 and 6 or 7 different points. Ours was very similar: core workforce, and this is considered the employees on a contractor's payroll who have been employed at least 60 of the last 100 working days. And what we were negotiated in our 2014 conceptual approval was that the contractor could come to the job with 6 of their core workforce, and for every worker beyond that, That worker needed to come from one of the trade halls. We negotiated 2 exemptions for offsite fabrication and batching facilities, as well as professional services in that document. We negotiated the exclusive use of the union apprenticeship program contained in that 2014 PSA. We had an opportunity to have a few, 1 or 2, I think, negotiations of memory serves up at the IBW Hall in Buellton, and we got a tour of their training facility, and I think it's the pipe fitters next door. They're just fabulous facilities. So that was included in the document that all apprentices would come from the unions. Item 5 and item 6 are really the big issues for our local contractors at that time. Union dues for non-union contractors. We negotiated no union dues for non-union contractors. However, we did include a window fee that would be collected by the union. And if memory serves, that was $15 or $20 a month to keep your name on the list so you could actually be dispatched to a job. 6 related to whether non-union contractors would have to pay union benefits. And we negotiated essentially 3 options at the time. Union contractors would continue paying union benefits. Non-union contractors with equivalent benefit plans would continue to pay into their plans. And non-union contractors without benefit plans would pay equivalent benefits into a trust for their employee. Local participation was established at 45%. And as I mentioned, TC were not able to, they were able to get all their affiliates except for one. And I think at the time there was 22 or 23 affiliates that fell under their umbrella. So let's spend a moment looking at balancing concerns. And again, this was one of the concerns of the board back in 2014. We wanted to make sure that we could maximize the number of bidders on a project. And this is the most current information. The book is called Construction Costs 2021 Annual Edition. It used to be the Sailor Report, but you can see, and I tried to list an example there, that we could see a 21% increase in bid prices if the number decreases from 7 to 3. So on a $5 million job, that job could essentially be, if you had 2 to 3 bidders, $5.8 million. And if you had 6 to 7 bidders, it could be about 4.7, 4.8. So there's $1 million delta in there. So we need to be concerned about maximizing the number of bidders on all of our projects. And in 2014, mitigating the risk of losing bidders on the AB 900 project was a big concern, because if memory serves, there was a lump sum amount of money coming from the state, and any dollar over that amount was going to have to be covered by the county of Santa Barbara. So our negotiating team at the time worked with various stakeholders to obtain input on some of the key items that I just went over, the 7 items that we were able to negotiate. And the goal of this effort, again, maximizing the number of bidders. And the stakeholders were very helpful to us in 2014 and helped us get through that process. And the second template we want to present today is the most recent CWA that was approved by the city of Santa Barbara. July, I believe it was, and the city had 4 points to resolve through this process, and the city council eventually was asked to decide on these points. On the local participation side, it encourages local contractors and suppliers to participate with a goal of at least 50%. Recall ours was 45, so that they moved the needle up there a little bit. On the core workers, they came up with a formula of non-union local contractors. I apologize, I forgot to put local in there because they have 2 different formulas. May directly employ up to a maximum of 3 employees of its regular local experienced workforce. And then they do a 1-for-1 ratio up to a total of 9. And then beyond that, 10 or more employees, they would come from the hall. They do have a different formula for non-union, non-local contractors. And the city, the way they described local, it was the Tri-Counties area, San Luis Obispo, Santa Barbara, and Ventura. In their benefit plans, the non-union contractors shall pay contributions to the established union benefits, the amounts designated in the appropriate trades labor agreements. And construction inspection and materials testing, the work of those consultants are considered a craft under the CWA. Thanks. So this brings us to the first set of decision points today. As I mentioned, we have 5 options to move forward. Option 1 would be to utilize the finalized City of Santa Barbara CWA. We can essentially substantially adapt the city's PLA CWA to the county of Santa Barbara, but there would need to be some modifications contained or some modifications would be required to the CWA to make it more county focused. Option 2 would be to utilize the finalized CWA as our base CWA and negotiate agreement terms within that document to maximize the number of bidders on our county projects in the future. That would revolve around those 7 points I talked about earlier, and we'll see that on the next slide. Option 3 would be to utilize the board's 2014 conceptually approved PSA as the county's CWA. Or option 4 could be renegotiate an entirely new CWA with TCBT. And 5 would be to provide any other direction your board feels is appropriate today on this item. And if we go to the next slide, apologize, it doesn't look too good here, but if option 2, 4, or 5 were picked, you can see the CWA points there on the left. 2014 PSA that the board approved, or in the middle, you can kind of see where we landed on the negotiations. And then the 2021 City of Santa Barbara CWA on the right. So if your board does want to pursue 2, 4, or 5, we do have this in an Excel spreadsheet format. When your board starts to deliberate, we can kind of get a sense from your board on kind of where you want that needle to kind of land for us on our county CWA. And that would give us, as your negotiating team, I think some guidance and some direction to sit down with TCBT. And then the other piece that we would like to get some feedback from you on falls into these 3 areas: stakeholder outreach, threshold, and pilot. I'll talk about threshold first. The city's using a $5 million threshold with various exemptions. And your board certainly can set whatever threshold you think would be appropriate. We don't really need that direction today because we have to go back and work on a CWA if that's what you'd like. But I want your board to start thinking about it a little bit, because we could probably come back. CEO Miyasato and I talked about maybe coming back in October, if that would work with your board. We can talk about threshold limits then. We can come in with a presentation from our capital improvement plan on public works projects over the next 3 to 5 years, general services projects over the next 3 to 5 years, and CSD projects over the next 3 to 5 years, to kind of show you what's out there as far as big dollar item type projects. And we can discuss thresholds then. We also need to have a discussion on what should be contained in the draft ordinance if we're going to create a CWA, and exemptions. The city had quite a few exemptions in there, and we should probably share those with your board as well, and we should have a discussion on that. Stakeholder outreach, as I mentioned in 2014, stakeholders were very helpful to us in the process. Does your board desire us to use stakeholders if we're going forward with the CWA process this year? And pilot, are we going to do this for one project? Or are we going to come up with an umbrella CWA for all projects in the county over a certain dollar threshold? Feedback on those last 2 would be helpful today. And I think this takes us to the last couple of slides, which are really just the recommendations from your staff report. And we are available, that concludes our presentation. We're available for questions.
Thank you very much. Do my colleagues have questions for Mr. McAlpin? And we have general services here too to answer any questions we have. And Supervisor Lavanino or Supervisor Nelson,
I have a few questions.
please.
Thank you. So a couple basic ones for me is like, what is, can you elaborate a little bit on window fee and what does that mean? How does that work?
Through the chair, Supervisor Lavanino, Dr. Rostoff, my memory is that it was a fee to keep an individual's name on a list at one of the affiliates. So if they were a carpenter and they were a non-union, from a non-union contractor, they didn't have to join the union, but they had to pay a fee to be on that list. And that's how the unions prioritize who gets called out when the contractor asks for either a core worker or once you get beyond the core workers, when the labor get dispatched from the union. There's probably some union folks that are going to be testifying today that can explain that much better than me.
All right. And then I'm always curious why, this is hard because 2014 was a long time ago, but refresh my memory why the local hire requirement is so low. I mean, we sold this originally first time around as a local hire ordinance, and I think our goal was 45, and now the city of Santa Barbara is at 50. Why aren't we at 80, 90%?
Madam Chair, Supervisor Lavanino, I'm not really sure I have an answer for that.
Okay. Well, again, maybe during public comment, that's something somebody can comment on. My big question is, a couple of them are, so the city made some different rules when they were talking about core workforce. And this might be for, I don't know who our county counsel on this is, Johanna or Rachel, whoever wants to comment on this. I have a question just, so they made different rules on their core workforce, if I heard correctly, for non-union local versus non-union non-local. And I'm just curious if that's legally defensible. Could you make a CWA? Because to me, there's a big distinction between local non-union contractors and non-local non-union contractors. So we know the people we're dealing with. We know the people we've been doing business with for decades. So I'm wondering if there's a carve out, or can we treat people differently that are local non-union as opposed to non-local non-union?
Supervisor Lavanino, I'm happy for us to look at that further. I will say that cities and counties are governed by different statutes. City of Santa Barbara is a charter city and we're a general law county. So there are some differences in what we can do versus what the city can do. So if you are interested in that, that's something that we can look at further.
Yeah, I would be. That would be very helpful. And then I guess the other one's more philosophical and more of a political question, so I'm going to save that one until I hear public comment. So,
Okay, Supervisor Nelson.
Yes, thank you, Chair Hartman. I just had a question for Mr. McAlpin on, are we aware of, the local workforce that we've had at this point on our existing projects? Like, do we know what we had on the jail so far?
Hello, Chair Hartman and Supervisor Nelson. On the jail, the local labor is tracking at 43.3%. We also went back and looked at statistics from July 2008 through May 2021, and we're tracking about 88%, and this is for the Tri-County, so Ventura, Santa Barbara, and San Luis Obispo on our projects.
So let me just follow up that question. So under our current bid practices, we're getting nearly 90% on our capital projects?
Yes.
Can you explain to me maybe why that we had such a low number on the jail? Was that because it's a specialty, or what's the reason for that?
So the number that I shared with you, the 88%, did not include the Northern Branch Jail because the Northern Branch Jail had a large component from Orange County. That's our general contractor. So that's why that number is lower, because a tremendous amount of labor came from Orange County for the Northern Branch Jail.
But to dive into that, does a jail, a jail might be very specific skill set on a general contractor for that. I can't imagine there's a lot of contractors that build jails, or that we have a few local ones. Is that it, or?
The local labor was in the trades such as, electrical and I know Patrick Zarowski's in Santa Barbara. I don't know, Patrick, do you have more to add to that?
And you know what? And just a moment, sorry, Chair Hartman and members of the board, we cannot hear Patrick, so perhaps he is muted on our end. Just checking with CSP TV first. And it could be because the mic is down. So if I have a member of my staff, if you can flip that switch in the hearing room, that would be great.
Great. Thank you for the opportunity, Chair. So the Northern Branch Jail is a specialty project. It's a $110 million facility that does require a certain level of speciality with our various subcontractors. It's not uncommon that a project of this size would import labor from a variety of locations across the state. We just do not have the local workforce to be able to provide the volume of specialized labor that's required. The overwhelming majority of our projects here locally that are of less than $110 million certainly are done with local labor across the 3-county area. So the jail itself, a lot of specialty contractors have to be imported, whether that's security, specific communications equipment, energy production equipment that is required for the jail. All of that is primarily specialty items. Very common that gets imported throughout the state or from the West Coast region.
All right, thank you.
Can I ask a follow-up to that?
Yes, go ahead, and then back to Supervisor Nelson.
Obviously I'm not, don't have your specialized expertise, but I've seen a lot of contracts from public bodies over 21 years. And at least what I notice is a lot of just the biggest jobs almost always, or at least more often, go to out-of-town generals. And out-of-town generals mean, general contractors often mean more subs that end up being out of town as well. And do you agree with that statement? Because I've seen this from the jail to the airport to big revamps of wastewater systems. It seems to go across different categories of jobs.
Supervisor Williams to the chair, I would agree with that. There are certain categories of construction, especially on the vertical side, that are very specialized, especially when you're looking at wastewater treatment plants, water systems, things of that nature. Even hospitals have specialty contractors that really hone in on those type of projects. And they tend to bring their own subcontractors with them. Of course, as part of an open bidding process, any general contractor in our region is welcome to bid. We encourage that. We go out and market our projects significantly. And I think that leads to some success, but some of these bigger projects, unfortunately, sometimes are won by general contractors outside of our region.
Back to Supervisor Nelson.
That was my only question for right now. I'll have some other comments after public comment.
Okay, seeing no more lights, we're on to public comment. And again, I think we have 31 commenters, so we'll limit time to 2 minutes, and we won't accept any more people after the 31.
Yes, thank you, Chair Hartman and members of the board. As previously noted, we have 31 requests to speak on this item, and we are going to begin in Santa Maria with Les Cushman, to be followed by Lee Cushman, and then Elias Garcia.
Good afternoon, Supervisors. Can you hear me okay?
Yes.
Okay. My name is Les Cushman. I moved to Santa Barbara in 1959. I worked for Cushman Contracting Corporation, a local contractor with 48 employees. We have been in business for 52 years. We have built countless projects for the county of Santa Barbara. As an example, we built your Lacuna County sanitation plant in 2001, which was a $9 million upgrade to the plant. By CCC bidding this job, we kept out of town and out of state contractors from coming in and taking local jobs. We've done various dredging projects for the county of Santa Barbara. Same thing there again. By us doing this specialty work, we've kept out of town, out of state contractors from coming in and taking this local work. We've built many beach access projects throughout the county. We've also, as a contractor and a family, in our company being a family, we've donated time and money to Santa Barbara over the last 52 years. One example is Glida Beach. When it was damaged by severe storms, CCC donated time and equipment to help clean up that location. In fact, I believe you were there one evening, Ms. Hartman, to witness the cleanup, and we donated that to the county of Santa Barbara. Didn't ask for anything, we just did it. We've participated in many of the creek cleanups in the county of Santa Barbara, donated time. Several members of our family have donated time to Doctors Without Walls.
And Mr. Cushman, that is your time. Can you just give us a quick wrap up?
Sure. I ask you folks, what if after 50 years of service as a supervisor, you were told one day that you're no longer able to do that job unless you join the union club? You're no longer invited. And I would also like to say that these projects are called public works projects, not union works projects.
Thank you.
Thank you.
We will continue in Santa Maria with Lee Cushman, to be followed by Elias Garcia.
Good afternoon, Supervisors. One thing that my brother Les missed was we hire union contractors for subcontractors for electrical and other activities. So we're very fair and very open. We always try to give the best price to the county. A CWA agenda that refers to the city of Santa Barbara, CWA, the city's community workforce agreement is not inclusive of the community of construction workers. It discriminates against workers who choose not to be represented by a union. If the true goal of the county is to achieve a CWA, please address the following 4 items. Core workforce. Allow work contractors who employ local workers to bring all of them. Do not do anything else is discriminatory. We cannot allow long-term employees to stay at home. Healthcare insurance. Allow all local workers to keep their current health insurance. This will prevent switching back and forth between employer plans and union plans and prevent lapses in coverage or double payment by employers. Allow workers to keep their existing retirement plans. Our employees, as those of other open shop contractors, receive the prevailing wage portion of their retirement in an IRA, which is the state approved and funded by the hour. This is IRA accounts as the employees and has no employment strings attached. They can leave anytime they want and take their IRA with them, unlike the union's plans. Underfunded union pension plans. The City of Santa Barbara work agreement requires contractors to sign up to take on these unfunded liabilities. An example of this is the Southern California Plumbers and Pipe Fitters Union pension plan, which as of 2019 was 55% underfunded to the tune of $1 billion. You can look that up on their 550, their Form 550. Not only is this unfair to place a contractor such as ourselves, who is 100% funded in our plan, to sign up for this, but to knowingly push a worker into this plan is irresponsible. We ask you if you're going to continue forward with the CWA to allow us to come to the table and discuss it with you. Thank you.
Thank you.
We will now go to Elias Garcia to be followed by Andy Caldwell.
Good afternoon, Madam Chair and members of the board. My name is Elias Garcia. I'm with the Associated General Contractors of California. We are a statewide contractors association, and uniquely for us, we represent both union contractors and open shop contractors as well. I just want to first thank you for the meetings over the last couple of weeks with each of you. It's been a great opportunity for us to be heard with you all. And our message is pretty simple and clear. We do not believe that a CWA is necessary for county projects. As has already been demonstrated, the county has successfully been building projects without a CWA up until this point. We do ask, however, if you are choosing to move forward today with a CWA, that you respectfully bring on contractors to the table to be able to provide that feedback that is so necessary. There are real repercussions for both union and open shop contractors when working on a CWA. Our union contractors will face jurisdictional issues when deciding which unions to assign the work to, and our open shop folks, they will be subject to the difficulties of not being able to bring on their entire workforce that they've been working with, in addition to paying benefits that they may never see. So in sum, again, we do not think that it's necessary, but should your board decide to move forward today, we simply ask for the opportunity to be heard. Thank you.
Thank you, Mr. Garcia.
We will now go to Andy Caldwell to be followed by Manley McNitch.
Chair Hartman, members of the board, Andy Caldwell. We've had almost every union on our board over the last 30 years. I have nothing but respect for them. However, I can't say that I've heard of any underemployment, either with union or non-union contractors in this region, except during the downturns of the economy. I believe right now that this is a solution in search of a problem, especially with when you have to ask the question, if 90% of your contracts are going to local employees, what are you trying to fix? Because you're going to go from 90 to 50. The issue here is, first of all, your staff report says you've got to be able to cite findings that there's a legitimate government interest and a necessity for this. What is the necessity? When was the last time a county project got hit by labor strife, or that you couldn't find enough people to man a county project? What is the necessity? You're taking 85% of the local workforce out of the labor force for county projects. You're 85% out when right now you've got 90% in. How do you do that math? The other thing is, we believe you should bid this. If you are going to do it, we want you to go back to the table with the all contractors. As you know us, what we want is we want locals hired. I don't even care if it's the lowest responsible bidder. If it's union or non-union, we want locals hired because you got the multiplier effect. That's what we want. And that's what we wish you can negotiate. You used to have a local vendor outreach program for that, but somehow it wouldn't apply to construction projects. We don't understand how this could apply and that couldn't apply. And again, we don't believe the system's broken, and anything you do is going to lower the threshold of how many locals are being employed right now. You're not going to hit 90% with this deal guaranteed.
Thank you, Mr. Caldwell.
It's going to cost taxpayer money and take food off of people's table. Thank you.
We will now go to Manley McNitch to be followed by Alex Perez.
All right, thank you for giving me this opportunity to speak today. I hear a lot of the complaints with the non-union element about how they're going to be paying double benefits and everything. But the problem is, it's extremely hard to believe that talked about on the CWA are actually paying their workers $68.32 an hour, and then paying some kind of a benefit on top of that. The 68.32 is in fact what some of the dramatic cost differences between union and non-union projects when they come in on the bid. It's almost impossible for these contractors to pay out of their pocket on top of the $68 and still be successful in bidding. So what they're typically doing, and it's my experience from working in union and non-union over my 45 years, is they pull the money back out of the fringe benefits, which is like $23.88. They'll put that money in 401ks or some other form of investment, saying it belongs to the employee. But out of that, more often than not, the employee still has to pay for their medical insurance, which really not right because it's their money, and then a contractor's claiming out of their big heart, they're paying benefits on top of that money. So they're not honestly paying benefits twice. They're paying it once with the employee's money. One of the biggest problems we deal with out there is misclassification and not using apprentices for skilled and trained workforce. The only way to stop this is through a CWA because it monitors the job and the contractors. The most recent one was the CWA up in San Luis Obispo. When that project went out to bid, it was awarded to a non-union contractor, PCL. They had bid the job with the intention of using laborers to do all the concrete work, over 12,000 hours. But because it was under a CWA, we were able to get those hours back and put them where they belong with the right trades.
And that is your time, so can you wrap it up?
Thank you.
All righty, thank you.
We will now go to Alex Perez to be followed by Jonathan Duran.
Good afternoon, County Supervisor and Chair. My name is Alejandro Perez. I've been a union carpenter for about 18 years, and 75% of my career, I've worked at least an hour away from home. I'm now a business representative for the Gold Coast as of January 2021. Before I started my current job, I was a labor compliance investigator and covered 6 states in the Southwest for about 5 years. My job was to uncover and track down unscrupulous and cheating contractors on public and private projects, uncover wage theft, workman comp fraud, tax fraud, EDD fraud, and so on. In 2018, I began an investigation on a new fire station being built by the County of Ventura in Fillmore, California, by a dirty, cheating contractor. We took our information and some evidence to the County of Ventura and expressed our concern to them in using this contractor, being that I'm a tax-paying resident in that county. It hit close to home. According to the county, their hands were tied because they had been awarded the project as lowest bidder. During the project, we uncovered that there was a total of 19 workers, a total of 19 workers being paid cash and are being misclassified as the lowest paying trade doing all scopes of work. With many quality issues on the fire station, it was eventually turned over to the county 2 years late. We compiled our investigation, turned it into the labor standards enforcement or labor commissioner, and they concluded their investigation. They issued a certified wage and penalty assessment with $500,000 in wages owed and $500,000 in penalties and fines. Let me ask you guys, who here in the county actually performs compliance on public works projects? Who monitors certified payroll? Who checks check stubs for the workers? Who does research on contractors before they award all these millions to these contractors who grossly underbid when all material, concrete, work trucks, drywall, wood, roofing supplies are the same price? The only way to grossly underbid on projects is by paying extremely low wages, even cash, like workers at the Fillmore Fire Station who were getting paid between $120 to $160 a day, or when they were supposed to get $63
That
an
is
hour.
your time. If you could wrap it up.
We need to hold the contractors accountable, and also the decision makers need to make the right decision today. We support a renegotiation for the CWA. Thank you.
We will now go to Jonathan Duran to be followed by Armando Delgado.
Good afternoon, Honorable Supervisor, staff, and attendees. My name is Jonathan Duran. I'm a representative with the Southwest Regional Council of Carpenters, Local 805.
Hold on one moment, sir. Sorry.
We're having some interference. Okay.
All right. Again, good afternoon, honorable supervisors, staff, and attendees. My name is Jonathan Duran. I'm a representative with the Southwest Regional Council of Carpenters, Local 805, a proud union member and a third-generation union carpenter. A community workforce agreement was welcomed by you, and staff was directed to move forward with it, regardless of what you hear from the opposition today. Trust that we are doing our part to make this the most beneficial opportunity for the county. We didn't come here to make promises. We came here to make a commitment to all the hardworking residents of the county. The proposed agreement will help many hardworking men and women to land employment locally, earn a decent wage, keep tax dollars here in Santa Barbara County. This should not be looked at as an expense. Rather, consider this as a return in your investment. For the past 6 years, we have participated, we have partnered with the school districts throughout the Tri-County region to providing them curriculum that leads a career path in the construction industry. Many high schools have dedicated instructors that support students with a pre-apprenticeship training and allow them to prepare a direct entry into the trade. Their choice in becoming a skilled and trained professional tradesman is further enhanced when they join an accredited certified apprenticeship program. After their graduation, these students will succeed far better in their profession when they have opportunities for local jobs or make more available. The transition from high school into the trades is hard enough, but even harder when you have to travel across county lines to find work and stay employed. How will they advance? By having local jobs. I asked the supervisors to move forward with the CWA and the renegotiation. Thank you.
Thank you. And you did it in 2 minutes.
We will now go to Armando Delgado to be followed by Danny Devereaux.
I'm going to speak pretty fast, so just follow real fast. Hey, good afternoon, honorable supervisors, staff, and all in attendance. My name is Armando Delgado. I am a United States Marine Corps veteran, an advocate for worker protections, and a representative of the Southwest Regional Council of Carpenters, Local 805. After my time in service, I came home and attempted to transition back into the civilian workforce smoothly. Yeah, that didn't quite happen as expected, and it usually doesn't for most veterans. I worked for small contractors that allowed me to work locally and be home early enough to enjoy the benefits of coastal living. However, I was in a dead-end job that offered no benefits and poor quality of life. Transition is difficult regardless of military service, change of industry, graduating from high school, or readjusting from the justice system. We need better pathways, and we have a solution. I advocate for worker rights, worker retraining, and most importantly, worker protections. When Northern California and other regions of our country were hit with the pandemic, they were forced to shut down. How then did the construction industry keep operating in the Gold Coast? Did scrupulous contractors and their paid mouthpieces lobbied our elected officials to protect our workforces? Doubt it. However, the trades did, and we not only spoke for our members, but the entire construction industry, along with other industries that were impacted by the pandemic. Since last March, we have been providing our members with COVID awareness training, emergency preparedness. The majority of our members have been vaccinated, not just to keep their jobs, but for the health and well-being of their loved ones. I'm a representative of the Southwest Carpenters. It's my job to create more opportunities for our members and anyone else willing to start a career in the trades. That's why we recruit military service members who are having difficulties like I did into our Stars and Stripes program. That's why we actively promote our Boots program for women, our Brothers Keeper program for traditionally disenfranchised community members and those transition into society from the justice system, and our Career Connections program for the students in high schools. We support your decision to renegotiate a new CWA that would facilitate the county's needs and actually make the workforce development work.
Thank you very much.
We will now go to Danny Devereaux to be followed by Joshua Madrano. Then we will go to Zoom with Lori Bennett. Thank you.
Good afternoon. My name is Danny Devereaux. I'm with Cal Portland Construction. We're a non-union contractor that does primarily road work and have done a lot of paving for the county over the years. We're opposed to the community work going ahead with the community workforce agreement. We see it as a huge disadvantage for bidding projects for non-union contractors, double paying benefits, not using our entire workforce, decreases efficiencies, safety, quality, and those add costs to our projects and our bids. The future pension liabilities that were mentioned earlier, and the lack of subs that would not participate in a community workforce agreement. All of those add costs that union contractors would not be facing. They could use their own benefit programs and their own workforce. But really, it's about the employees. Employees, which for non-union contractors comprise 85% of the workforce. They wouldn't probably vest in any of the union benefits, and they would go unused. Unused fringes for our employees right now get paid out in cash. And let me give you a quick example. We have cafeteria style healthcare. The highest quality program is valued at $13.15 an hour. If they have spousal insurance or covered through veterans, they get to put that in their pocket as additional wages. Community workforce agreement, it would go into the union coffers. They would lose work because we would have to sit some of our employees down while we're working union workforce with the community workforce guidelines. We can't pave an additional and keep those other guys working because I can't pave with a half a paving crew. They would be forced to work in a union shop when they originally chose to work non-union. This should be really an employee choice and not a government mandate. Again, we're against the moving ahead, but if you do move ahead, we ask that we are able to participate as a stakeholder and a sounding board to the Public Works Director as he would if you choose to go ahead with a community workforce agreement.
Thank you.
We will now go to Joshua Madrano, our final speaker in Santa Maria, and then we will go to Zoom for a virtual public comment with Lori Bennett. Thank you.
Well, hello, esteemed board and the rest of the community out there. My name is Joshua Medrano, and I am the Executive Secretary and Treasurer of the Tri-Counties Building and Construction Trades Council of San Luis Obispo, Santa Barbara, as well as Ventura, representing over 14,500 men and women of the labor industry. To name a few of those, we represent the asbestos heating and frost insulators, boiler makers, bricklayers, allied craft workers, cement masons, electricians, elevator constructors, iron workers, operating engineers, painters and allied trades, pipe trades, plasterers, roofers and waterproofers, sheet metal workers, teamsters, and stand in solidarity with our brothers and sisters at Southwest Regional Council of Carpenters, as well as the Laborers LIUNA. Now, you have heard many arguments about the CWA, but let me give you some truths. CWAs keep local tax dollars local, putting local workers to work and continuing to fuel our local economy. The local hire provisions of CWA will set hiring goals that allow for specific communities such as veterans, women, and underserved communities to benefit from the local jobs created on the project funded by local tax revenue. CWAs guarantee the opportunity for local students to enter local apprenticeship programs to start careers in the construction trades that provide head of household jobs with healthcare benefits and pensions. CWAs are required by law to be non-discriminatory, and they do not prohibit non-union contractors and subcontractors from bidding and winning work. They do ensure that local workers are paid the prevailing wage for the work that is being done and that our local tax dollars stay here. CWAs ensure labor peace by setting out the terms under which building trades unions agree not to go on strike or picket the job, that they help prevent delays, maintain workplace safety, and ensure high-quality construction products, all of which help protect taxpayers' investments when public money funds some, or if not all, of our projects. I urge all of you to do your homework and to continue opening negotiations with the building trades and move forward, renegotiating a CWA to keep our workers here, as well as our dollars and cents here. We appreciate your time and look forward to working with you. Thank you.
We will now go to our public comment via Zoom, and we will begin with Lori Bennett, to be followed by Eric Christensen. And for those of you participating via Zoom, you do not need to use the raise hand feature. We do have a running list. Thank you.
Good afternoon, Chair Hartman and members of the board and staff. I want to start by thanking and acknowledging the Tri-County Building Trades Council for the strong support that they have given and are continuing to provide for their union members. The union leadership and dedication to employees' economic and physical well-being has been paramount. Since the 19th century, the unions have been the foundation for which modern construction trades, for those union members as well as those merit shop or non-union tradesmen and women. The pay, benefits, training, safety considerations, and life-work balance is the norm throughout the industry. From my almost 40 years of experience in the construction industry as a member of a third-generation family business with both union and non-union tradesmen, I am proud of them all. Your county is so fortunate to have a wealth of skilled tradesmen and women, but if the board and county staff see a true need to replace the existing long time and successfully implemented lowest, most responsive, responsible bidder that is fair to all county construction trades employees and employers, please bring the merit shop employees, employers, and trades associations to the table so we can collaborate, not just negotiate. I'm an active advocate of construction trades education and training. Let's invest the additional 15% cost in this PLA CWA agreement to pre-apprenticeship programs in our middle and high schools. Actually, let's get the elementary schools educated on the trades. I do hope you make the outcome of your decision on this as beneficial to the greatest number of your trades member constituents as possible and to the greatest extent to your taxpayers. And finally, I want to also say thank you to each of the supervisors for your time and sincere discussion on this issue. Whether we agree with each other or not, I felt listened to and acknowledged, even if you had your mind already made up. I am not sure I could ever do the jobs that you do for the public, so thank you very much.
Thank you, Ms. Bennett.
We will now go to Eric Christensen to be followed by Russell Johnson.
Good afternoon, supervisors. My name is Eric Christian. I'm the executive director of the Coalition for Fair Employment in Construction. 21 years ago, CFEC was formed by union and non-union construction firms solely to oppose the discrimination and waste found within project labor agreements. I wanted to point out tonight the most striking feature of this presentation is the lack of efficacy for the PLA. There's been no explanation as to why it's necessary. Some of the supervisors have extended us the courtesy being blunt enough to just explain. They just believe that there needs to be more union workers in the world. But that's a choice for the marketplace. And currently the marketplace shows that 85% of the local construction workforce, both in the Tri-County area and the state of California, chooses to be union free. That's a choice that the government shouldn't force people to make. The local hire issue, it's already been explained. You're already hitting 43% on a low end on your large project, which is what the target was for the PLA back in 2014. And 90% for all of your other work. Those of you that were able to watch what I can only describe as the debacle at the city of Santa Barbara when they voted for their PLA it was so low, the union number they were seeking, which was 30%, despite staff showing they were already at 75% as a city, that one of the council members actually just said, let's pull the local hire language and not use it at all. She was shamed into having to put back in, and that number was put up at 50%. Again, the county was already achieving 55 to 75% local hire numbers. So this isn't about local hire. You're already achieving that. It's about explicitly and implicitly discriminating against an entire class of people based on their group affiliation. You wouldn't do that with any other group of people, yet you're doing it today. Have a core workforce number that allows for all local contractors and workers to be used, not 3, 4, 5, or 6, all of them. Have their pay follow the worker. Don't engage in wage theft. The last time I checked, that isn't a progressive value. The money should follow the workers, not be put into a union trust fund they don't get. And all state approved apprenticeship programs should be able to be used in any negotiations you undertake. Thank you.
Thank you.
We will now go to Russell Johnson to be followed by Bill Baker.
Yes, thank you, members of the board. My name is Russell Johnson. I also want to extend my thanks for giving us your time and your courtesy in many of the meetings you had, hearing out from many of the local contractors, as well as from the representatives of ABC and some of the other non-union apprenticeship programs. I want to point out that some of the speakers mentioned some goals that they felt would be achieved with the CWA can be achieved without a community workforce agreement. That is, apprenticeship is a pathway that exists. It's mandated on all public works projects. ABC has apprenticeship programs. These are wonderful pathways to careers in construction. We ask that all apprentices be allowed to participate on all public works projects, because when you shut out unilateral apprenticeship programs under a CWA, you leave our apprentices on the sideline. And when you leave our apprentices on the sideline, we have a shortage of the need for skilled trades in California, and our workers have less opportunity to get the on-the-job training hours they're required to have to pass those apprenticeship programs that we offer. Also, I want to add that we urge you to avoid the CWA, as it will shut out and leave out local workers. But if you decide to move forward, ABC formally asks for a seat at the table so that the associated builders and contractors can provide the county with our experience and our insight as to what community workforce agreements will do and how it will potentially disenfranchise your local workforce. Thank you for your time, and we appreciate it.
We will now go to Bill Baker to be by Chuck Huddleston. And
Hi, my name is Bill Baker. I represent the IBEW here in Santa Barbara County. I was listening to one of your supervisors on the radio, and he doesn't think this is a low force issue, but it is. And not with our local contractors, but with the out of the area contractors that bring their entire workforce with them. The CDA would not disqualify our local contractors. It actually gives preference to all of our local contractors. CDAs usually allow our local contractors a greater number of the core workforce. Area contractor be allowed, which means that contractor be required to hire our workforce and not bring in workers from other areas. This is not a union or non-union issue. I urge you to vote yes. Not only work and tax dollars local, but providing for apprenticeship to our youth and our cities. Let county staff and villagers move forward and negotiate a CWA that will benefit the county of Santa Barbara. Thank you.
we will now go to Chuck Huddleston to be followed by Amanda Olofsson.
Had to get unmuted here. Hear me okay?
We can.
Well, thank you. Good afternoon, Chair Harmon and County Supervisors. I'm John, Business Manager, Financial Secretary for IBW Local 413. First, I'd like to thank Super Lagunino for acknowledging qualified workers in the construction trades that include people who are historically underrepresented in the trades. Community workforce agreements improve worker safety by requiring contractors and workers to comply with safety rules. Should this community workforce agreement be adopted, it will mean a larger percentage of construction wages will stay in Santa Barbara County, bringing taxpayer dollars back into the county's coffers. I strongly urge you to vote and move forward to adopt a community workforce agreement that delivers positive long-term economic benefit to our local community and our workforce in the construction industry. And on the part about stakeholders, I was around during the last negotiations, and one of my agents was in on the negotiations, and stakeholders continually put sticks in the spokes of negotiations that made it very difficult to reach an agreement. It had a lot to do with us not signing the agreement and getting it done with the county way back then. I'd be happy to answer any questions about that. Although I wasn't in negotiations, my assistant was. Thank you very much.
We will now go to Amanda Olofsson to be followed by Michael Lopez.
Hi, my name is Amanda Olofsson. I am with IBW 413. I am a foreman for a local contractor, Taft Electric. I'm here to vote for we'll hope you guys vote for a CWA. A CWA ensures that we have the right training. It ensures that our job site stays safe. And I went through the 5-year apprenticeship, and I can tell you I learned a lot about the safety aspect. And in my trade, that's very important. As an electrician, we come across a lot of different dangerous things, and without the proper training, it's, an accident's just waiting to happen. The CWA would also ensure that we have diversity on a job site. As a female, I I never work with other females. And it'd be nice to see more females on the job site. Local work, it means that we have local labor. I work on so many job sites where people are traveling from LA. They don't see their families for a week at a time. It's horrible. I worked on the North County Jail. So as for Mr. Nelson, that was an out-of-town general contractor, but a lot of the subs were local. Taft Electric was on that job. We are based out of Santa Maria. Bragg was on there, Toma. And a CWA provides our best shot of keeping the bids local with local contractors. I'm on a job right now, a public works job that's mixed non-union and union, and we don't have a CWA on this job. One of the contractors comes from Cerritos every day. It'd be nice to see more local contractors get these jobs so that our taxpayer money stays local. Thank you very much.
We will now go to Michael Lopez to be followed by Rudy Bachman.
Good afternoon. Can you hear me?
Yes, we can.
Thank you. Thank you so much. And I really appreciate all your efforts. Staff, you guys knocked it out of the park. I would like to tell you about all the complete falsities that are being brought to you by those who oppose this. But frankly, you did all the heavy lifting for me. There was a couple of really good questions that were brought up by a couple supervisors earlier. One was, low bids are going to hurt us. There's a little unknown fact from people who are not in construction is that low bids are bad bids. These are people that will come in and bid extremely low to get the job. Everybody feels great about themselves. And then 6 months later, you come back and you realize, hey, you know what? Your engineering staff forgot 30% of what's supposed to go into that. And then you get hit with extras. In a union shop that's a more reliable, consistent, longer legs in the community, they don't make those kinds of blunders. That's something you need to pay attention to. There's also, my good friend Andy brought out 90% employment. This is a joke, right? We're not talking about 90% employment over all the work in the community. We're talking about specifically PLA or community workforce agreement. This is a high threshold job. These are specific jobs like the jail. And Supervisor, my good friends pointed out that isn't it obvious that most of these, or isn't it common that most of these large jobs are exclusively being done by out-of-town contractors? That is a fact. That's what happens, and they bring in all their out-of-town people. Those situations are, in fact, around 40% employment. So 60% of the people on those jobs are coming from out of town. That's the way it's always been. Union contractors specifically do the high technical, the high quality work in this county, and frankly, in the entire state. Please recognize that what these contractors are doing is what they do best. They're protecting their profits. That's what's important. Do not be misled that they speak for their employees. That's a joke. Organized labor has been speaking for the employees of construction in this county and in the state for well over 100 years, and we're still here.
That is your time.
Okay. Thank you so much.
We will now go to Rudy Bachman to be followed by Richard Markison.
Can you hear me?
Yes, we can.
All right, thank you. I had a mute sign come up. My name is Rudy Bachman. I'm president of Specialty Construction. We've been in business for over 25 years, and we've performed over $200 million in value of public works projects serving many communities locally, including Santa Barbara County, as well as many public agencies throughout the greater Central Coast. Our main office is in San Luis Obispo, and we also have an office on De La Vina in Santa Barbara. We're a local company with over 100 employees, including many skilled craft workers that work on your publicly funded projects receiving prevailing wages. So obviously we have a vested interest in local hire practices and the CWA under consideration before you today. Our experience is that over the last 20 years, it's that there is open, good competition with local companies, both union and non-union, providing good construction services to your constituents. And frankly, I don't see where there's a problem in need of resolving or addressing as far as hiring local trades, craft workers, or participation. We are a merit-based non-union shop. but we work with many union contractors as well as employ union apprentices when the unions cooperate. So I want to be very clear that specialty is not anti-union, and rather we work very well and we count on many union subcontractors, many of whom have been represented by their union reps who have spoken here today. So we believe in and strive for the same worker goals as a union: safe working conditions, fair treatment, training, continuous work, greater self-direction, and control of their fringe benefits for their retirement and healthcare. We're able to provide those same benefits to our craft labor in many ways even better, as we do truly hire local and provide all those aforementioned desired labor conditions. So under a CWA or PLA, those few core...
That is your time, Mr. Bachman. Can you just wrap it up with a few sentences more?
You bet. So those few core employees that we would be allowed to use would have their fringe benefits go to the union pension and health plans, which they would not get vested in and lose, contrary to the weekly vesting that they receive their retirement and health fringe benefits immediately vesting on a weekly basis under our current plans. Thank you for your time.
Thank you.
We will now go to Richard Marcuson, to be followed by Kelly Perez.
Good afternoon, supervisors. I'm Richard Marcuson, and I represent 4 specialty subcontractor organizations who are also sponsors of state and federally approved apprenticeship programs. Through the course of your hearing, you've heard of a variety of comments from supporters and opponents of project labor agreements or community workforce agreements, some of them wildly inaccurate. But one of the recent comments by a union representative that struck me, in as much as the county is already achieving an 88% local hire under your current contracting practices, which is an admirable local hire utilization. He pointed out that the real issue were the very large projects, the $100 million and above projects like the North Jail. So I would encourage the Tri-County building trades to embrace that sentiment and set a very high threshold for the implementation, so that in fact you do not displace the local contractors from this small jobs, and that a 75 or $100 million threshold. And the other point that I would encourage you to pursue, and this has been raised by a number of associations and individual contractors, is make sure that you include contractors and contractor associations in the negotiation of the collective bargaining agreement that you will bind all workers to. Consider for a moment that you are approaching the negotiation with the county sheriff's association for your county sheriffs. And someone that has no experience with law enforcement or perhaps even negotiating collective bargaining agreements is going to come in and negotiate the terms and conditions for your own employees. That is what you are proposing to do. You are not the employers of the construction workers, but you are negotiating the terms and conditions of their employment. And there seems to be a certain inequity in you assuming that responsibility. Thanks very much. We look forward to working with you as you carry this further, and we wish you great success. Thank you.
Thank you, Mr. Marcuson.
We will now go to Kelly Perez, to be followed by John Bloom.
Chairman Hartman and members of the board, I'm with Blum & Sons Electric. We're a family-owned Santa Barbara County electrical contractor and have been in business for 49 years. Papa Joe started this company in 1972, and all 3 of his sons joined the company, and now his grandsons are going through apprenticeships with WECA so that they may carry on the family business. We have 85 employees overall, 65% of which live in Santa Barbara County. What problem is a CWA a solution to? On public works projects, contractors already pay the same wages as the union contractors. If your concern is wages for construction workers in Santa Barbara County, a CWA is not the solution. It does nothing for construction workers on private projects. If you want to help raise wages in construction, you would need to pass a law making all private construction projects, including residential projects, prevailing wages. A CWA won't help workers, it will only hurt them. 59% of our construction employees live in Santa Barbara. The balance live in the Tri-Counties. 85% of our projects are located within Santa Barbara County. How many local non-union trade members live here? According to the Bureau of Labor Statistics 2020 statistics, construction workers living in Santa Barbara County that do not belong to a union is 83.8%. That is a lot of constituents that have the potential to be financially harmed by a CWA. Why would you vote against the interests of 83.8% of construction workers? Why would you force us to lay off local highly skilled employees and be forced to employ a stranger from another area, perhaps from Los Angeles, while being held liable for their quality of work? That's what the city of Santa Barbara's CWA does. A CWA forces us to lay off our indentured apprentices that live in Santa Barbara and hire a union apprentice from potentially another area. How does that help your constituents? Why would you force our employees to lose up to $20 per hour in pay that instead of going to them through their 401ks would go to a union trust fund that they will never be vested in? They will never get that money back.
Ms. Perez, can you wrap it up in another sentence or
Yes,
two?
I can. Yes. What does that have to do with building things? What does that have to do with helping your constituents? I want to thank you for listening to us today, and hopefully, we can all negotiate and get a reasonable CWA if you insist on signing one, but it needs to be something where the employees don't lose their money, that it doesn't have to go into a union trust. It can go into their 401ks and they can maintain their health insurance. Thank you.
We will now go to John Blum to be followed by Ariel Arroyo. And John Bloom, if you are available and can please unmute your microphone and begin your comments. Chair Hartman and members of the board, perhaps we can return to John. We will go to Ariel Arroyo to be followed by Alejandra Martinez. Ariel Arroyo. If you're there, please unmute your microphone and begin your comments. Thank you.
I'm here. I just came to listen to everybody else along with Alejandra Martinez.
Okay, you can start.
Oh, no, me and Alejandra Martinez were just speculating, listening while everybody else spoke.
So you don't wish to make public comment today?
No, I think things I was going to say.
Okay, thank you.
All right, we will go to Tony de Trinidad to be followed by Spencer Brandt. Is Tony de Trinidad there? If so, please unmute your microphone and provide your comments. Moving on, we will go to Spencer Brandt to be followed by Roy Reed.
Good afternoon, Chair Hartman and Board of Supervisors. I just wanted to call in today and support the use of community workforce agreements. These agreements are good for local workers and local contractors and for the county. For the county, independent studies have shown that CWA projects actually get more bids than those that are non-CWA. Independent studies have also proven that these agreements do not increase costs. By contrast, they achieve cost savings by standardizing the terms of the various craft agreements in the area, including work hours, paid holidays, and overtime. Some folks today have used this occasion to express their political disagreement with unions. They have asked what the necessity for this agreement is. Well, take a look around. Just about every week at this board hearing, we hear about the inequities in economic, social, and health outcomes across our county. These unions are a vehicle for improving those outcomes for working people in our county. They provide apprenticeships, job training, and jobs that allow workers to be able to afford to live, thrive, and grow in our community, permanent, good-paying jobs and healthcare. Unions and their members are our friends and neighbors. They are local. They are our community. Thank you.
Thank you.
We will now go to, unfortunately, it appears Roy Reed is not available at this time. We will go to Jim Dining, who is our final speaker. And Jim, I see you just unmuted yourself. You can go ahead and begin your comments. Thank you. Jim, we can't hear you. Perhaps your phone is muted on your end.
Check 1, 2. Good afternoon.
There you go. We can hear you. You can go ahead with your comments. Thank you.
My name is Jim Denning, and I grew up in Santa Barbara County. I've worked in the local construction industry for Cushman Contracting for over 25 years. I don't want to join a union. Why should I be forced to join a union as a condition to work in my county? Why should I be forced to join big labor when I want to work with a small family-owned company? Why should the company I work for be forced to use union hiring halls instead of using me, a local 25-year veteran? I'd be forced to go sign up at the union hall and hope they send me to a Cushman contracting project. Why should I be forced to pay into a union pension plan, which I would lose if I don't become vested? The union confiscates this money and my check would be reduced by 20%. Cushman provides good health insurance and a fully vested pension plan, which I keep if I leave. Why am I forced to accept union representation and pay union dues as a condition of employment? This should be my choice. I work locally for a small company. We are efficient and competitive, which gives the taxpayers best price for quality work. Union labor and the lobbyists want to rig the bid process to favor big labor and out-of-town companies. The CWA ends fair bidding on public works contracts and costs the taxpayer more money. Small local companies would not be able to work locally, which means workers would not be able to work in the area in which we live. The CWA harms local businesses and minorities. The County of Santa Barbara should ensure fair and open competition on taxpayer-funded projects. This will preserve taxpayer dollars and continue to provide small businesses and minorities opportunities to work on county public works projects. Please vote against this CWA. Thank you.
Thank you, Mr. Denning.
And that was our final speaker.
Okay, let me first ask Mr. McAlpin, do you or Mr. Snedden have any comments, reactions to what you heard?
Madam Chair, none at this time.
Okay, thank you. It's back to the board and Supervisor Hart.
Yeah, I appreciate everybody who spoke today, taking the time. You know, these hearings that are at the end of the day are a challenge for folks to hang in there, but I really appreciate people taking the time to communicate with us. And I appreciate the folks that I met with to talk about this. I'm an advocate for a community workforce agreement. I think that we should move in this direction. I supported it 2 years ago when we began this process, and it's taken a long time to get here. The city of Santa Barbara has done a lot of good work working with the construction unions and the Building Trades Council to develop a template that I think we should really use as a guidepost because it was successful. It's gotten to the place where there is buy-in from the unions. And this is the approach that we took back in I guess it's been 7 years ago, 2014, did not result in a successful conclusion. So I'd like to see us move as expeditiously as possible to implement the community workforce agreement. And I hope our board will support that today.
Thank you. Supervisor Williams?
Well, I think one of the narratives of this is interesting, which is that this idea that that the majority of non-union workers are non-union because of their own choice, and I actually don't believe that for 1 minute. Workers tend to want the job that pays better and has higher benefits, and generally, as a general rule, and I appreciate those non-union contractors that are the exceptions to this rule, but generally, union workers get better wages than non-union workers. And so why don't more non-union workers become union workers then if they get paid better? It's because of they're going to the work that they know they can get. And so from the perspective, I think, of a public body, we want both a higher number of local workers, and I would dispute, I think using a statistic like 90% that excludes the biggest job and that we had anytime recently is just not an accurate picture at all. And so we want both local workers, and we also want workers who are getting paid enough and getting enough benefits. And it's hard to set a bar, but it makes sense for us to set a bar. And so for me, that's what this is about. This is about us as a community, having, in my view, a desperate mission to protect what's left of our middle class. I don't want good non-union contractors that actually do pay good wages to be just collateral damage. And I actually think that that the core workforce provision in the city of Santa Barbara ordinance will ensure that you're not. I mean, it means that you could have a large number of employees of your core workforce working on a job. And so I would submit that there will be a number of the non-union contractors that have always done a lot of this work, that will continue to do some of this work at that core workforce provision level. And I know it's a figure that the trades are uncomfortable with. Some of the crafts really are freaked out about that, middle ground in a core workforce provision. And so I think, but it shows perhaps a path. I also think this is something that has been promised for a long time. And so we've been really clear. And if anything, we've taken a long time to deliberate on this. And I think that, my door is open. I'm willing to talk about it. I always have been. I think Scott's door is open. I don't think that anybody in this room can accuse Scott or any of us to not being willing to discuss this. But it comes down to who you negotiate with, and to use the metaphor that one of the speakers used against us, when we negotiate with the deputy sheriffs, we actually just negotiate with the deputy sheriffs. We don't negotiate with the sheriff too, right? We negotiate with the workers, and I think when a community workforce agreement, at the end of the day, we should negotiate with the workers. So my opinion is we should move forward with the city of Santa Barbara's one as a template. I am concerned that the threshold level is not really applicable to us. We're a much larger jurisdiction than the city of Santa Barbara. I looked at a lot of the bids, a lot of the estimates in our public works projects, a year and a half ago. And at that threshold level, there really would be not a whole lot covered, particularly since some of the biggest bids have already passed. So I think we should do a lower threshold, but leave it up to our staff to negotiate something based on the city of Santa Barbara's template.
So I hear two who are supportive of option one. Supervisor Lavanino?
I just had a question there. I did not follow that end logic. So I was just trying to get this. So you were saying that the city of Santa Barbara is smaller than us, but that we should have a lower threshold than the city does. So I was just trying to figure out I didn't follow that.
Yeah, I mean, it's based both on, I don't think that our kind of jobs are the same as their kind of jobs. Some of them are similar, but not all of them are. But the further logic of, I just went through all these projects that were upcoming and their estimate cost, and 5 million wouldn't include very much. So I don't. So that's more my logic, Steve. Particularly because, I think, to be fair, this policy was promised 9 years ago, right? And it's just taken a long time for a variety of reasons. I don't want to cast blame on anything, but in the meanwhile, the 3 biggest contracts that are in the decade are already gone, right? Already done. And I would submit that one of them, at least, it maybe shows us some evidence that maybe we should have had this policy in place.
So are you talking about the North County Jail with that?
Well, yeah, I'm not sure that it could have gone a whole lot worse, but.
So do you think that was the contractor or I don't think we really want to get into in public right now what the problem with that was, but I don't think it had anything to do with none.
Yeah, I'm not putting it all on that, but in my experience, the bias of the system towards out-of-town contractors on the biggest jobs, and I'm not just talking jail jobs, same thing goes with the airport, same thing goes with a bunch of other things, is not good for any of the people who have showed up here today.
Right.
Not a single one of them. It worked out for some workers because they were on the job, but as a whole, having, big time contractors from Orange County or from out of state as the GC coming in on all the big jobs doesn't help us.
And that's not going to happen under a CWA?
I would submit that it would become less likely.
So Supervisor Nelson or Lavanino?
I'll let Supervisor Lavanino go first and all.
Okay.
After that.
All right. So first off, I got to say that big kudos to all the people that came and spoke, because you all have basically your livelihoods on the line. And there are 2 sides to this. I've got friends on both sides. I've got friends actually on 3 sides. I've got non-union, I've got union, and I've got people that do both. And so the fact that you guys were able to come and be level-headed and not really get into a bunch of name calling, just disagree on some basic concepts. But I think that should be an example for other people in other fields, that this is a forum that could get heated. And I appreciate the fact that most people, stuck to what their personal belief was instead of really getting into a shouting match. So, for me, I'm getting the frustration from the other board members that, we wanted to do this. They wanted to do this for a long time. It hasn't gotten done. City of Santa Barbara kind of beat us to the punch. And so now let's just implement the city's new CWA. But I don't want to sell theirs as the middle ground. because it isn't a middle ground. A middle ground is when, I'm not really sure why we would deviate from what we normally do in this county, which is we like to bring stakeholders together. We like to work on a problem, and then we come out with a consensus. Now, in 2014, we got really, really close. I mean, we did that. We heard from everybody. And outside of, I believe it was operators, we had everybody else at the table. Everybody else signed on. So I don't think we're that far away from like, oh, this is never going to happen, and let's just adopt this other one and shut these other folks out. I think that sends a really bad message to the other side. So, I was sitting here scrambling the whole time trying to say, okay, what is the benefit for the taxpayer? And I didn't hear what I heard 7 years ago, which was the quality of non-union contractors was substandard. That was the message from 7 years ago. And I think people now have moved away from that. So if the quality is not any worse, we're going to the low bid. All workers are paid prevailing wage on the same job. I really think if this was a pressing issue, Scott McAlpin, who we all agree is a leader and been with our Public Works Department, leading the department since I've been here over 11 years, he would have brought this to us a long time ago and said, this is something we have to do. But it doesn't come from staff. It's top down. So I'm still looking for that compelling reason. The thing I would support, absolutely 100% support today would be a CWA for non-union, non-local folks. If you're coming from outside, you've got to follow basically our rules. But I see no reason why we're going to discriminate against folks that we currently do business with that are doing an outstanding job, that hire 100% local. They have a lot of local people working for them. And a lot of them, like we talked about, people trying to form a middle class. These are the people we're talking about. And I just don't see why we wouldn't at least invite them to the table and say, let's try to discuss this. But I'm just kind of in that gray area where I just don't see. I think both sides do an awesome job, and I think that there's enough for everybody. Some people like to do it one way, some people like to do it the other way, and I don't see what's broken right now. So you saw respect for both sides, and I will say, to me, like I totally value the work that our union folks do, especially when it comes to education, second to none. And we've got to do more of that. The one public speaker that spoke, I think her name was Lori, was talking about, hey, let's start investing and figuring out what's going on with. And I know our Assemblyman Jordan Cunningham, pushed this. We got to get kids involved in the trades, but that doesn't mean that they would have to be union workers. I would let them choose. So that's where I'm at. I would not support moving forward unless everybody's brought to the table. Put it that way.
Hey, Supervisor Nelson.
All right. Thank you, Chair Hartman. I've got a question. I don't know if Scott has this or maybe Joshua Medrano from the Tri-County Building Trade. But how many local halls do we have in Santa Barbara County I guess what's the number to begin with? I think it was 23 back in 2014. Is it still 23, groups now? Is it more than that? And then again, of those 23, how many do we have in Santa Barbara County that have local halls? Because that's really important as a part of not only the, having the local hires, but also having that apprenticeship program available for our young men and women coming out of our high schools.
Through the chair, Supervisor Nelson, Joshua from TCBT, I think it's coming up.
Okay, thank you.
Currently, we represent the asbestos heat and frost insulators, boiler makers, bricklayers, cement masons, electricians, elevator constructors, iron workers, laborers in solidarity, operating engineers, painters and allied trades, pipe trades, plasterers, roofers, and waterproofers, sheet metal workers, teamsters, and as well in solidarity with Southwest Regional Council of Carpenters. That is currently who we have in Santa Barbara County, San Luis Obispo, as well as Ventura County. Thank you.
Josh, I was wondering how many of those halls are in each of those that are like physically located in one of the in our county. So I know about the plumber pipe fitters, I know the carpenters.
If you were to include the multiple crafts within a craft, such as the operating engineers, the pipe trades, as well as the iron workers, it's a total of 21.
Okay, so they all have apprenticeship programs that are physically located in Santa Barbara County.
No, these are union halls that do have multiple areas that they work out of. So they also have sister locals as well that they do their training. So to say if their training is here locally, that cannot blanket all of them, because they do have to keep those county lines in San Luis Obispo, Santa Barbara, as well as Ventura. So we have to keep access with those entities.
So all 21 of those unions have apprenticeship programs in the tri-counties?
That's to my understanding, as well as on the outskirts. So
like LA County, or is that
correct? Because if you take a look at these locals as well, they belong to district councils as well. So depending on the particular craft that they're associated with, that's where their area would be, and those crossing of lines would be specifically for training.
And that wasn't a gotcha question. I wasn't trying to.
Oh, no worries. Thank you. Appreciate the question.
Yeah, please. And where I'm coming from, I really appreciate the apprenticeship program. Just Josh, that's it for Joshua. Thank you.
Okay. Thank you.
I really appreciate the apprenticeship program. I've got to thank the plumber pipe fitters, Mike Lopez and Nick Harvey. I mean, they've really done a lot of work with me personally to educate me on what the value that they bring to our community. I'm a former CTE teacher myself before getting into a local government. So I know the value. I know that's something that doesn't necessarily fit on a bid, and it's something I want to support. I also am very concerned about local hire, and I really want to make sure that we're doing everything potentially to have more employees or more workers on our public works contracts that are from here. I believe that you get a better quality product when the person that's working on the project may have to send their kid to school there, or drive on that road, or potentially be in that hospital. I think that there's a lot of value. I've seen some out of area contractors just recently that just want to get out of the area as quickly as possible, check all their boxes and move on. So I think when somebody actually has to drive by that building every day, there's a certain amount of personal pride that is important there. That said, that can be a union contractor or a non-union contractor. So I want to get to a place where whatever agreement we come to does bring forth more local labor if possible. I know that the Supervisor Williams kind of said that, for the 43% couldn't get much worse in the jail. That's, I was hearing the initial number that some of the trades might want to start the negotiations at was at 30%. And I like to see it as much higher at 70%. Maybe that's a good number. And I've heard that might be a deal killer. And I don't understand that. I think that that's something that we should be really pushing to as a county, because I think that accomplishes what the goal of a CDWA would be. I know that there's been discussion about whether, why the 2014 agreement broke down. And, I think it's really simple. The reason why it broke down was over one trade group not signing that. 22 out of 23 signed that agreement. And, I think that seems to be a process that was a strong CWA that probably should be our foundation, because we were already one trade away from having an agreement. I think that that's something we as a county should be looking towards as we move forward, if this is the direction the county wants to go. I still want to hear from Supervisor Hartman on this. I think I've heard from obviously my other colleagues. But if that's the direction we move forward, I don't want to be an obstructionist. I want to get the best agreement to assure local workers, to promote apprenticeships, and also to be a good steward of our taxpayer dollars on our projects. And one of the things that I like to see us look at is, again, if projects come in above engineer estimates within a certain threshold, maybe that we go back out to rebid with a CWA and a non-CWA. I think that might be a good protection for the taxpayer in the end, and might help prevent against any bids that are in excess of what we want to spend on a project. So those are my thoughts moving forward, would be to start with the 2014 agreement and have stakeholders, and then again, having some kind of taxpayer protection on thresholds above engineer estimates for maybe rebidding with a CWA and a non-CWA.
Thank you. Well, like my colleagues, I very much appreciate the meetings and the initiative that people took in talking to all of us and commenting this afternoon in detail and passion and educating us about what these issues mean to you. Santa Barbara County is really fortunate to have so many skilled craftspeople and companies. And I appreciate it was a long day to wait, and I thank you for hanging in there with us. In general, I'm very supportive of the concept of unions and collective bargaining and the empowerment of employees. I think that it is very important when people can work together in dealing with management, and so that's a value that I have. I'm very supportive and just want to echo what so many colleagues have said about the education programs that I've seen in the facilities that the unions have, and the contests and the quality and the pride. I've had opportunities to each year come and see some of the contests and see how the apprentices are learning and how they're taught. And that to me is one of the most impressive things I've seen. Project labor agreements, community workforce agreements are not for every project. They're for complex, specialized, really high value projects. And I think we have to keep that in mind. If we look at the 43% at the jail local workforce, we don't have a lot of comparison, but I think of Port Hueneme, where they have a workforce agreement and they had a 73% local hire. So I do believe that with these more complex projects, a workforce agreement is a way to get the local hire that we all up here and in the audience today are eager to have in the contracts that the county has. I am supportive of the model that was developed by Santa Barbara. I think that 2014 is a lot of years ago, and I think we've come a long way, and there's been a lot that's already negotiated that we can build on. I think there are issues, I think the issues that I think are important are local, quality, and safety. And I'm also very interested in, what the union people have said about veterans and women and underrepresented people in the trades. That is very important. And I gather that some project labor agreements, community workforce agreements actually have those conditions built in. I was looking in the Santa Barbara agreement, and I may have missed it. There's a lot of detail, but that would be important for me as a term. Now, I think if I understand Mr. McAlpin, if we are, if we have 3 votes for a particular option here, then you and your staff would take this back. You would look at various projects and bring that back to the board. We don't have to decide on a threshold today. There is one thing that I am willing to think about here, and that is whether we would put a term limit on this and then come back and look at it 3 to 5 years, and then come back and analyze what we've learned and what we need to change. And we may have to do that even before, but I think that's something I'd like to ask my colleagues if they are willing to support. And Supervisor Hart or Supervisor Williams, would you like to weigh in on that?
Well, Madam Chair, if you like, I can kind of weigh in on what you asked me
Please, yes,
initially, and then,
okay.
the term part, we could probably talk about when we come back and we talk
Okay.
thresholds as well, because that's something we have thought about a little bit. From the conversation I heard, on the dais and through Zoom, there seems to be consensus around option 2. For
Yes.
the most part. So we use the city of Santa Barbara as a model, if you will, kind of a base for us to negotiate around. And if we could get the screen, this computer screen up real quick, we do have a little bit of a kind of a workshop spreadsheet here, and maybe you could give us some, it's not going to look, it's kind of washed out. I asked Chris if he would kind of note the areas you were talking about. We tried to highlight what we heard today from some of the speakers as well. It kind of seemed the majority of the speakers seemed to mention core workforce, the union dues for non-union contractors, unit benefits to non-union contractors, and local participation obviously is key, front and center on this. So realizing we'll use the city's currently approved CWA as the base, and if you would allow the negotiating team some flexibility, then when we go in and work with TCBT on some of these points that came up today, I think, yeah, that's working pretty good. It's a lot better than it did look, so thank you. So we can go in and we can negotiate around that, Supervisor. We did hear one supervisor favor stakeholders, and there was a comment earlier about the stakeholders, and I led the team in 2014. The stakeholders were very, very valuable for us because they did educate us on what some of these key points from CWAs or PSAs at the time meant for their businesses. And the way we ran the negotiations back then, it was the county sat at the table with the union, TCBT, but in the morning we met with the stakeholders, and they kind of helped us along on what these terms would mean for their business, the dollars and cents, and what it would do for their bottom line. So, and that's how we were able to get to that balanced 2014 PSA. So, so that would be helpful to us. And the other, I think I've heard that the CWA would be more countywide versus a pilot. So should we consider that your direction as well as we go forward, as we commence these negotiations?
I see 3 nods.
Okay.
Yeah, CEO Miyasato?
Just one more thing. I think if the board majority would like us to use the city of Santa Barbara as the base for Mr. McAuliffe to negotiate, thank you for that direction. I also want to be sure that when we come back, there are different provisions of that agreement because the city of Santa Barbara is a charter city and the county is required to follow the laws pertaining to us as a general law county. So we want to make sure, obviously, that your direction be for him to use it as a base for negotiation, but obviously we want to be legally compliant with general law county law.
Madam Chair?
Yes, sorry, Supervisor Hart.
That's all right. I think, well, I really appreciate all of the comments from board members, the tone and tenor of the hearing today, the participation from the public, all of our colleagues. This isn't a new issue. This has been something that's taken a very long time to gestate and get to this place. But I'm encouraged that, we have a path forward. And I think that staff's suggestion that we utilize, the way that the board is coalescing around number 2, using the city of Santa Barbara's recently negotiated agreement as the template for our base agreement, and obviously tailoring it to the constraints that we have as a county as opposed to the city is a smart course. We can talk about the threshold later, but I'm sympathetic to the idea of lowering it. I'd like to see it applicable to more jobs. And yes, I think what we're proposing fundamentally here is a countywide CWA, not just a pilot program, because we want to see these benefits happening comprehensively countywide.
And a term limit, would you be open to that, or what are your?
I mean, I think we can figure that out when we
next
bring it
time,
back.
but it's
And, you know,
something that we
something-
could have be brought
Yeah,
back to us
absolutely.
options.
I'm willing to make sure we get to success with this approach. And if somebody wants, I can make a motion, or we can have more discussion, whatever.
Supervisor Nelson and then Williams, but then we can come back to you. Supervisor Nelson?
Yeah, just bring up the spreadsheet for a moment. I think I understand what the C and the P meant on those.
Through the chair, Supervisor Nelson, C means the city agreement and P means the PSA.
Gotcha. Okay, so we're not going to go through each one. We're just taking it uniformly.
We just, we did that for brevity, but if you'd like to talk about each one, we certainly can. We're prepared to, whatever your board desires.
Well, I think, I mean, as you move forward to negotiating, the more information you have from us, and unless the board is fine with everything that the city of Santa Barbara has generally accepted, I don't mind going through each one. There's certain points that should be made on each one, I think. Maybe not. And then the other question for my colleagues was, I think it'd be good to give direction to our negotiators on that taxpayer protection piece, on if the project comes back above engineer estimates, maybe above 10%, that it'd be rebid. I think that's really important, especially as we talk about competition. As some of the speakers have mentioned, we actually have more competition. That might be a non-issue, but if it ends up becoming an issue, we have fewer contractors applying. I think it's on us to make sure that we're protecting the taxpayer and marshaling those, or being good stewards of those funds. Make sure that we get the most for them. I know that Supervisor Williams said that most of the big projects are already through. We're getting a lot of money through ARPA and other funds, and this board is, as we've been saying, is swinging for the fence on some big infrastructure projects. So I do see this coming up a lot more often, and should be something that we keep a close eye on.
Well, how do my colleagues feel about the taxpayer projection rebid if it's over 10% of the engineer's estimate?
Well,
is that something that we could have Mr. McAlpin and his team bring back as an option to think about?
Well, I think Scott would already bring it back to us. I mean, I have never seen a public works director that's worth their salt that doesn't, if it's that far off engineer's estimate, doesn't bring us back the option of rejecting all bids, right? So, as much as I would like to say that that's innovative public policy, I just think that that's
standard operating
procedure. That's the way we ought to do it,
But again, codifying it would help.
Yep. And Madam Chair and to Supervisor Nelson's question and point, we can certainly work that into the draft ordinance and to the language in the
so it's
CWA.
Explicit.
Yes.
Okay, I think we're ready.
I do have a question, Madam Chair, still.
Yes.
I'm not clear if the direction is for Scott to work with the stakeholders or to not work with the stakeholders.
Supervisor Hart.
I think that the time has passed for negotiations in the classic sense with the stakeholder model, because the city of Santa Barbara has done that essentially through their multi-year process. And I think all that would do is introduce more delay. So I prefer the model of staff working directly with the Tri-County business trades and building trades, and move this forward as fast as we can.
Final comments from Supervisor Lavanino or Nelson?
Well, I would just, I understand Supervisor Hart's position, but I'm wondering if if there are three of us that think that that should happen. Because I certainly do. I mean, to me, it's like we walked away from this in 2014 when we were 6 inches away from the finish line. So it's not like it took us all this time. It took 10 weeks and we got something that was acceptable to 99.9% of the people, and one walked away. So, you know, I understand you don't want to wait forever, but I'm just curious if there's consensus to do it or not.
Supervisor Williams.
I think it's essentially already taken place. I mean, you know, Scott McGulpin's door has been open. Our doors are open. And frankly, you know, I got to give this to, you know, the anti-PLA movement. They've been extremely disciplined in their messaging, but in the meetings about engaging with the stakeholders, but they've not been willing to talk about what the right level of core workforce is with me or other provisions. So it doesn't seem like they actually at least want to engage on the details. They want to talk about whether PLAs are right or wrong. And I think we decided that we want to move forward with a PLA. And so, you know, I'm happy to continue to engage with folks. I think Scott is, I think all of you are. But the negotiations should be with the employee representatives.
Final comments from Supervisor Lavanino or Nelson?
Yeah, I like to just make sure it's known that I'm a second to asking stakeholders to be involved. I'm with Supervisor Lavanino that we were very close in 2014. For the record, I would support a motion for a PLA that involved the 2014 as a foundation, along with the other protections I've talked about. I don't think that we should cede county policy to the city of Santa Barbara on this. That's a really bad look as a county. We wouldn't cede our land use authority to the city of Santa Maria. Why would we cede this to the city of Santa Barbara? You know, it's got 7 representatives that represent their, 80,000 people. Well, we've got 5 representatives that represent our 450,000 people. We should be way more engaged in this process. Besides taking that template just because it's expeditious. This is very important. We're not putting a time frame on it. It's going to be with us for many, many years. And I want it to be successful and something that really truly represents the entire county, not just the advocacy out of a single city. So I won't support the motion.
We don't have a motion yet,
Okay.
but
Well, direction.
okay. I did want to say that the Santa Barbara is a base, but it will be adapted, and I think that is something that Mr. McAlpin has emphasized here in the Santa Maria hearing room. So let's see. Supervisor Hart, did you want to make a motion?
Yes, I'll make a motion to direct staff to negotiate a community workforce agreement using the city of Santa Barbara's template to draft the county ordinance.
And Supervisor Williams.
I will second that, and I think we've said enough. I'll second.
Madam Clerk, would you call the roll?
Supervisor Hart,
Aye.
Supervisor Lavanino,
No.
Supervisor Nelson,
Unfortunately, no.
Supervisor Williams,
Aye.
Chair Hartman.
Aye.
Motion passes 3-2.
Well, it's been a long day. We are now adjourned to Tuesday, August 24th, and that meeting will be in Santa Barbara.